Okay, we're going to get started here. Good morning and welcome to the Temple College of Public Health Professional Development Symposium. As Chief Development Officer, it is my distinct pleasure to greet you all this morning. I would like to begin by emphasizing that today's event would not have been possible without the support of two dedicated groups of alumni leaders and stakeholders, the College of Public Health Board of Visitors and Alumni Association Board of Directors. I would also like to acknowledge and thank our Professional Development and Mentoring Program co-chairs, Brian Lindberg, Marvin Nichols, and Jasmine Edwards, as well as our Assistant Director, Samantha Coco, and also Louisa Clem for meticulously coordinating today's event. Providing a way for our distinguished alumni, community, and friends to share their knowledge with students and partner with us to best position OWLs for success in the workforce has been a long-standing vision for both boards. More importantly, today's speakers know firsthand the meaning of Temple's motto, perseverance conquers. They are more than just experts in their fields. They are change agents and advocates committed to giving back in order to make the world a better place. Featured in today's program are keynotes from two remarkable alums and 2020 Temple Alumni Gallery of Success honorees, Dr. Sandra Davis, who will discuss implicit bias in healthcare, and Commissioner Kimberly Ali, who will share her journey to building a career in public service. I encourage every participant with us today to fully be present, ready to listen and ask thoughtful questions. During my time with the college, I've had the great privilege to get to know each speaker, and I am confident that you will be inspired by their stories and find the knowledge and advice shared today invaluable. Before we transition to the first session, I would like to review a few brief housekeeping items. To enable participants to interact with speakers during the live Q&A sessions, the symposium has been created as a Zoom meeting. For the best viewing experience for each speaker, we encourage you to use Speaker View. We also ask participants to please remain muted throughout the event unless instructed by the panelists otherwise. During the live Q&A, please use the chat function to type your question. And for those that may need to miss a session during this morning's symposium, a recording of the sessions will be made available for all to view after the event. Lastly, please be mindful that while an incredible amount of thought and preparation went into delivering an exceptional experience for participants today, the event is live, and should a tech issue arise, please be patient with our staff and follow instructions as they are given. Now, without further ado, I would like to turn the program over to our outstanding Dean and Laura Carnell Professor of Public Health, Dr. Laura Siminoff.
Well, thank you very much, Natasha, and good morning and welcome to today's event. I want to thank and welcome all of our wonderful alumni, our students, and our faculty. Together, we all make up the community of the College of Public Health. Today's symposium takes place as we approach a full year of living in a country radically altered by COVID-19. And unfortunately, a few days after the United States surpassed 500,000 deaths from the pandemic. We find ourselves living in a time when public health is more important than ever, but our mission has remained steadfast, creating evidence-based health solutions, affecting social change, and delivering effective, compassionate care in order to improve health and well-being for all, no matter what one's circumstances are. Today's event will explore the new challenges and opportunities that have resulted from the pandemic. And I'm not going to go through all of that because we have a wonderful panel that is going to do that. So what I would like to do right now is to welcome our keynote speaker, Dr. Sandra Davis. Dr. Davis is an associate professor and assistant dean for diversity, equity, and inclusion at the George Washington University School of Nursing. She is a fellow of the American Association of Nurse Practitioners, and she's been recognized for her work in diversity, equity, and inclusion, otherwise abbreviated as DEI. Dr. Davis earned a Bachelor of Science in Nursing and a Doctor of Podiatric Medicine at Temple, so she is a double alum. She earned a PhD from Drexel University and a Master of Science in Nursing from the University of Pennsylvania. So I am really, really thankful to her that she's chosen our alumni board amongst the many that she could have chosen to be involved in. And we are fortunate that Dr. Davis serves as director at large for our Alumni Association, and she is chair of our inaugural Diversity, Equity, and Inclusion Committee, which is really helping to develop and promote alumni-eccentric DEI programming. Dr. Davis has an extensive history of fighting for diversity, equity, and inclusion in both academia and in healthcare, and she has a deep understanding of the vast work that remains to be done in this area. As a leading expert in DEI, her expansive work in both academia and public health practice are huge. And I just want to mention a few, and this is nowhere near an exhaustive list. It's just to give you an idea of some of the things she's been doing. She's working with the DEI group of the American Association of Critical Care Nurses to enhance diversity in academia and the nursing health workforce across the nation. She was the principal investigator of a study that amplified middle school student voices through the use of photography, critical analysis, and narratives. That project was exhibited at the Smithsonian National Museum of African American History and Culture and at the Children's National Art Gallery. At George Washington University, she's created a broad range of important learning experiences on bullying and implicit bias, and these serve as a national model. Dr. Davis is keenly aware of the important intersection of public health and personal health that defines our college. So it is truly a pleasure and an honor for me to welcome her here today. Please join me in welcoming Dr. Sandra Davis.
Dean Seminoff, thank you very much. Thank you very much for the introduction. I am delighted and truly honored to have the opportunity to deliver the keynote address for the College of Public Health's first Professional Development Symposium. To our students and alumni, good morning and welcome. Your participation in today's symposium demonstrates your commitment to personal and professional growth and to advancing healthcare, public health, and social work, three professions with foundations strongly rooted in health equity and social justice. I'm going to share my slide, share my screen. Okay, so, and I talked about the healthy people. And so, in fact, we really haven't achieved significant progress on eliminating health disparities and achieving health equity. In fact, data from a 2019 study suggests a clear lack of progression in health equity over the past 25 years. In 2015, Dana Bowen Matthew, now dean of the law school at George Washington University, published a book titled Just Medicine, A Cure for Racial Inequality in American Healthcare. In that book, Matthew asserts that if we do not give serious attention to implicit bias, we will never see the progress that needs to happen to eliminate disparities and achieve health equity. Indeed, there are many types of implicit biases that are based upon our social identities, such as race, religion, class, socioeconomic status. However, with the disproportionate impact of COVID-19 on BIPOC communities, the racial injustices in this country, and the months of worldwide protests, this presentation focuses specifically on racial implicit bias. By definition, implicit bias is the attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner, whereas explicit bias operates at a level that includes awareness and conscious choice and intentionality. Implicit bias operates outside of our conscious awareness. Findings from research have shown really that we act much more in accordance with our implicit or subconsciously held attitudes and beliefs, and much less in accordance with what we say we believe. Therefore, as we move forward with this presentation, there are 3 things that I would like for you to do. First, I ask that you invite humility while cultivating curiosity. I am asking that you invite humility because we all believe we have egalitarian principles, right? We believe that all people deserve equal rights and opportunities. We uphold the 3 pillars of democracy, of course, life, liberty, and the pursuit of happiness for all people. However, when it comes to implicit bias, we know that our unconscious biases often run contrary to our stated beliefs about who we are as human beings and what we value. Consciously, we are deeply committed to treating all people fairly and equally. However, unconsciously, our behavior is exhibiting something different. So what I want us to do is to be curious and ask, why does that happen? And how does that happen? Second, implicit biases are triggered, rapid, automatic mental associations that we make about people and the attitudes and stereotypes that we hold about people that are unconscious. We know these implicit biases are often based on inaccurate information. Also, we know that implicit biases impact our decisions, our perceptions, and our behaviors. So once again, as we go through these exercises in this presentation, I want you to pay attention to the process of implicit bias and be increasingly aware of your own bias. Pay attention to how you're feeling and why you're feeling that way. And then third, remember, no blame, no shame. Everyone has implicit biases. It's a part of who we are as human beings. Moreover, we live in a very racialized society. Now, I'm going to share with you 3 stories. As providers, practitioners, and clinicians, we tell and hear stories all day, every day. We make critical decisions based upon this information. So I'm going to share with you the beginnings of the excerpts of 3 stories. First is the story of Tyshawn Jones. Tyshawn is a 22-year-old male born in Detroit, lived in Section 8 housing, and attended public schools in the Herman Gardens section. Tyshawn Jones. Our next story is the story of Jose Gonzalez. Jose is a 25-year-old male born in the United States, born to immigrant parents from El Salvador. Our next story, the story of Lisa Nguyen. Lisa is a 28-year-old female from Vietnam, and she's lived in Maryland for 8 years. Okay, just the beginning, 3 stories. And so now I want you to think, when you were listening to those stories, what were you feeling? What were you thinking? Okay, so who is Tyshawn Jones? Tyshawn, who attended public schools in Detroit, lived in one of the most under-resourced areas in Detroit in Section 8 housing. Who is Tyshawn? Is he the young gentleman on the left, or is he the gentleman on the right? Next, Jose Gonzalez. As you were listening, you're listening to the story of Jose. What did you hear? Born in the US to immigrant parents from El Salvador. So who is Jose? Is he the man on the left, or is he the gentleman on the right? Lisa Nguyen, as you were listening, what did you hear? She's from Vietnam. She lived in the United States for 8 years. Okay. So what just happened? Let us move forward. I want you to fill in the blank, do a word exercise. As I say the word, fill in the blank. Night and, black and, young and, okay, right. Very simple, nothing difficult about this exercise. And you probably had a response ready long before I prompted you to say anything. And so this is the power of our implicit cognition and the lightning fast associations that we make. So when faced with incomplete information or information, we rely on our associative memory to quickly fill in the gaps. It's also important to note that most people, right, we all had the same response. So it's possible to have similar associations shared across various groups of people. And that's what we call stereotypes. Okay, next. If you can read this paragraph, it's probably because our minds are very good at putting together pieces of information in a way that it's easy for us to make sense of. Our minds do this automatically without our conscious control. This is a terribly written paragraph. However, we were able to read it without much difficulty at all. Our unconscious cognition automatically made sense of the paragraph based upon our ability to associate it with words that we already know. Another example, we see 3 letters in a row. Next, we see 3 numbers vertically in a column. Okay, so even though the middle figure in those images never changed, our brains are able to form different perceptions of the same image based only on the surrounding context. And this is done without our intention, without control. And so what these exercises demonstrate is the adaptive, the automatic, and the associative nature of our implicit processing. When faced with information, our brains try to quickly make sense of it by relying on information already stored in our memory. More important, these stored associations do not have to be based on accurate or logical information. Just by seeing concepts grouped together repeatedly, we can internalize associations that are distorted or skewed or inaccurate. And so in her book, Bowen Matthew describes step by step how implicit bias works in the brain. Okay, so so I want you to note this. The first step is what she calls storing social knowledge. And this happens over a lifetime, from the time we're infants. It involves everything that we hear and see and feel and experience in the world around us. So that stored knowledge of social groups comes from all of the messages that we've taken in from family and friends and teachers and what do we watch on TV, on social media? What do we see on TV, books, and so forth? And then the second step occurs the moment 2 people meet. As Americans, we live in a race-conscious society, and we're conditioned to instinctively identify the group to which another person belongs. And then within milliseconds, we retrieve from our memory the most dominant associations that we have stored with regard to that person's racial or ethnic group. The stereotypes are triggered and are used in shaping our understanding of the situation, once again, regardless of whether or not they're accurate. So our stored stereotypes can displace information that's right in front of us. Implicit biases have a dominant impact on how we think and act toward members of other racial groups. I have another exercise that I really want to go through because it pulls together, illustrates everything that we're talking about. Okay, so I would like you to say the word aloud. Say the color of each word. Don't read the word. As I go through, just say the color. Okay, here we go. Okay, good. Very good. Now, let's try it again. Remember, just say the color of the word. Don't read the word. Okay, not so easy this time, right? Okay, so our implicit inclination to read the words in the first one aligned with the explicit directions to say the color. But that didn't happen the second time. And so this demonstrates our implicit and explicit goals can and often do diverge. And so this is why implicit bias matters. While we like to think of ourselves as rational and logical and equitable and fair, the reality is that a lot of our thought processes are occurring unconsciously without intention or control. Those implicit biases, when activated, can derail even our most sincere, explicit intentions. Another important point is that our implicit biases flourish under three conditions. They flourish when there's a power hierarchy in conditions and situations of high discretion, such as clinical decision making, and under time pressure. And really, this is how we practice as clinicians, practitioners, and providers. We practice under these conditions, right? All day, every day. So we have to take this seriously. And so what can we do? I challenge you to become equity-minded practitioners, right? And that means by being an equity-minded practitioner means that you recognize first, you recognize problems of disparities and inequities and injustice in your practice. And then you're responsible. You take the responsibility to act and to address them. And so I want to give you 3 tools that you can use on an individual level, on an institutional level, and then on a much broader structural level. Okay, on an individual level, personally, this is very intentional, very deliberate. I want you to become aware of your own implicit bias. Right? Be very concerned. This is key. Very concerned about the consequences, right? Because what can happen? Be very concerned about the consequences of the bias, and then learn to replace them with non-biased responses. And then this is why I have that picture of the 2 individuals with the coffee cups, because it's important that we get to know each other at an individual level. Right? And this is how we build, as our dean said, we build the compassion, we build the empathy, we build the understanding, we build the trust. Right? This is so important. Next, let's move to an institutional level. This is where we work. We work in institutions. And so we have to develop an inclusive excellence model where inclusion really is excellence. And so where we have these cultures of inclusivity and belonging. And within those environments, we value individuals, all individuals equally. And then what else is important? It's important that we recognize and rectify historical injustices. And so this means knowing histories and knowing all histories. And so what do we want to do? We want to build the capacity for talking and listening and learning and really facilitating that intergroup dialogue. So important. And then knowing that equality is not enough. Equity is the imperative. So we need to meet people where they are. And so now let's open it up and move it to a broader level. And I want to share with you a definition of racism by Dr. Kamara Jones, who's a family physician and epidemiologist. So racism is a system of structuring opportunity and assigning value, right? So it's a system. So we often fail to understand the systemic nature. It's a system of structuring opportunity and assigning value based upon the social interpretation of how one looks, the social interpretation of how one looks, or what we call race. And what does that do? That unfairly disadvantages some individuals and communities and it unfairly advantages other individuals and communities. And then this is the important part here. This is important. And it saps the strength of the entire society, the whole society. So what does that mean? We're all in this together. All of us, we're in it together, right? And it saps the strength through the waste of human resources. And so think about all of the potential that's never actualized, the excessive morbidity and mortality. And so this sums it up and pulls it together. And so knowing this, right, it compels us to move outside of our organizations, to move upstream. I know we practice in downstream models, but move upstream and affect policy, right? Join your national organizations, join your community organizations, your school boards, your economic development task forces, right? Your grassroots organizations to advocate, to examine, to change policies and practices. So as you move forward with laying the foundation to build your careers, right? To pursue your dreams and to fulfill your goals, I want you to be the change that needs to happen. So I thank you. And I now want to, I believe we have more time. I'm going to stop sharing my screen and we can have questions. And let's see, we can do questions and answers and have a session. Samantha, is that right?
That's perfect. Thank you, Sandra. This was wonderful. And for really thinking about what you said with equity is the imperative, and let's meet them where they are. And I think that really just speaks to your leadership on our board and your inclusive approach to everything you're doing. So thank you. So thank you all we have many participants who are here today. If you have questions for Sandra, we've already received a few. Please feel free to post them in the chat, as well as at this point, if you're interested in turning your camera on for a more interactive experience, you are more than welcome to do so as well. And so we'll move on to our first question, if that's okay with you, Sandra.
Yes, please.
Wonderful. So we have a question. What is your advice in confronting these biases in the workplace with causing change and not causing uproar?
Okay, great. This is a great question. And so there are many levels to that. And within our organizations, right, we have to be very aware of our leadership. And what is our leadership doing? And what are our policies? Do we have a zero tolerance policy? So when these things happen, where is our support? And who's going to support us? And when things like this happen, who do we hold accountable? Right? Are they going to support us in this? And so what do you do when these things happen? And so I always, have a strategy. And so always first is safety, right? So that's of the utmost concern. So think about your safety, the safety of others, those around you. And then we think about how do we want to approach it? Because in some organizations, there are already policies where there's something like a oop and an ouch and an oops. And so when things like this happen, so they've had the discussions, they've done the work, right? They're really trying and they're making an effort. So it is the expectation when things like this happen that we're going to confront each other in a way that we understand that this is not acceptable and this is not what we do. And then also understand that no blame, no shame, once again. And where is there that opportunity for growth and for learning and for teaching? But then places don't have that. So we have to make those decisions in terms of, do we do it on the spot or do we do it in private? And so until we get to that point where we're moving, that we can have these authentic and open conversations where the expectations are the zero tolerance, where we have something in place where we can expect that we can talk to each other. Until that happens, we have some decisions to make. And the other thing that I want to say about that is that, you know, this is so important because emotionally, right, psychologically, physically, this takes its toll. And supposing you don't confront something, supposing you don't say something, think about all of the energy. I'm not saying if it's right or wrong at that point, but think about all of the energy that you expend in, oh, I should have said something. Why didn't I say something? You know, I'm blaming myself. But then think about, you know, those times when you're at that point of, why should I say it's not? Yeah. So this has serious consequences. And these are all issues that organizations need to take on because they're having very serious mental, psychological, emotional, and physical effects. And so we're at the point where really it is no longer acceptable to excuse it, or that's what he does, she does, that's business as usual, that's what we do, because we really know that it causes harm, right? Yes, on the recipient. And so together, we're all in this together. Our organizations, we have to start talking and holding each other accountable so that we don't have just, you know, check the box and empty mission statements, but that we're really doing the work so that we can make progress.
Wonderful. Thank you, Dr. Davis. We've had a few more questions come in the chat, some of which you have touched on, but we definitely wanted to ask you, generally speaking, how do you think we, as in recent graduates and students at Temple College of Public Health, can be more involved in our communities in becoming young advocates for health equity?
Right, that's so important. And so oftentimes what happens is that we want to do something, we want to help, but we just don't know how to get involved. And so, and I recommend that there's so many resources, and especially being here at Temple, there are so many places. So right within the college, for example, if you get in touch, you can give Samantha your name. If you get in touch with our alumni association, wow, we have connections and we have networks and we're out in the community and we know those organizations and we know the organizations that need help. We know the organizations that need people, that need members, and we know the work that's being done. And so this is really why it's important to have organizations like the Alumni Association, because that's somewhere to go. And we really do have the resources and we really can point you in the right direction because we know who's doing what out there in the community and how they're doing it. So I would be really, if you could leave your name with Samantha, I would be really more than delighted to make some of those connections. And that's the other thing about being Temple. We're all connected, you know, we can get on, we can call each other up, we can make those connections for each other. So as you grow in your career, there's this wonderful network, and that's what it's all about, networking, making the connections, rolling up your sleeves and getting there and doing the work. And so thank you very much for that question.
Great, thank you, Dr. Davis. Well, time has certainly flown by this morning already, and we are really excited to move into our breakout sessions where we've had participants identify if they wanted to participate in pursuing advanced degrees, as well as kickstarting your career. So momentarily on your screen, you will notice the opportunity to join one of two breakout sessions. And we will have you click into the breakout session that you'd like to join. Once you're in the breakout session, you will take a quick break for coffee or water or whatever else you might need. And the next session will begin in that breakout room at 9:45. We do ask that you do not leave the Zoom call because it will take you out of that breakout session. So once you're in your correct breakout room, you can go ahead and mute your microphone and take your camera off, and we'll see you at at 9:45. Thank you. And if you have any questions, please send them to us in the chat. Wonderful. In the meantime, I would be very grateful to tell you a little bit about our speakers we have today. We've put a lot of thought into who would be best to be on this panel in this session, and we're really excited for who will be presenting to you and the topics as well. So we'll start with Matt. Matt Shellick currently serves as the president of Delaware County Memorial Hospital at Crozer Keystone Health Network. He joins Crozer Keystone after serving as the chief executive officer of Roxborough Memorial Hospital. Matt spent 6 years at RMH from 2009 to 2015 in progressively accountable leadership roles leading up to chief operating officer. He then spent 2 years at Pottstown Memorial Medical Centers as COO and Jennersville Regional Hospital as interim CEO. After an extensive search for RMH's new leadership, it became clear that the best choice was someone who knows the hospital and the community. Matt's background reveals a roster of clinical positions dating back to his days at Temple, Capital, Rehab Care, and Nazareth Hospital as an occupational therapist. It was at Nazareth that he started his career as a hospital administrator, putting his Temple MBA to work. From there, he escalated to chief operating officer at RMH and soon held responsibilities at Roxborough's sibling facility, Lower Bucks County in Bristol, PA. In addition to earning an MBA from Temple University, Matt earned a certificate in occupational therapy from Temple and a bachelor's degree in business administration from Millersville State University. He is a member of the Tri-County Healthcare Council and has been a volunteer coach for youth sports for many years. Matt is actively serving as a member of the Temple University College of Public Health Board of Visitors since he joined in 2017. Matt, we're so excited for you to be here today. Next, I'd love to introduce Mike Ossino, who is our Assistant Dean of Admissions, Enrollment Management, and Student Recruitment right here at the Temple College of Public Health. Michael Ossino serves as the Assistant Dean of Admissions, Enrollment Management, and Student Recruitment at the College of Public Health. And in this role, Michael oversees the development and execution of all strategy and tactics that support the recruitment and admission of talented future professionals, clinicians, and researchers to over 20 disciplines and over 50 academic programs in the college. Michael has nearly 15 years of experience in higher education marketing, recruitment, and admissions. He also serves as an adjunct assistant professor in the College of Liberal Arts at Temple University, where he has taught a variety of undergraduate courses since 2010. He also serves on the executive board of the Greater Philadelphia Hispanic Chamber of Commerce. Michael holds a Bachelor of Arts degree and a Master of Liberal Arts from Temple University. He resides in the Fishtown neighborhood of Philadelphia with his fiancee, Kate. Thank you, Mike. And finally, Abby Shepard, who is our Senior Associate Director of Admissions at the College of Public Health. Abby Shepard serves as the Senior Associate Director for Admissions at the College of Public Health at Temple University. And in this capacity, she is responsible for developing and implementing full cycle recruitment, admissions, and enrollment strategies for all graduate level degrees and certificate programs within the college. In her previous higher education roles, Abby has worked within enrollment management, student and alumni affairs, international student recruitment and programming, and conference event planning. She has over 10 years of higher education experience. Abby holds a bachelor's degree in political science from Temple University and a master's degree in higher education from the University of Pennsylvania. So thank you very much all for being here today. We're so excited. And thanks for bearing with our minor tech issues that we've had today as well. So without further ado, I'm really pleased, Matt, for you to give us sort of a little bit about your background and why you've chosen the education that you have over the years and really how it's impacted your career. So thank you, and I'll turn it over to you.
Good morning, and thank you. I'd like to thank the College
You're
of
muted, I'm
Public
sorry.
Health. Oh, I'm off mute. Can't hear me?
Can't hear you.
I can hear you.
Can hear.
Everybody else can.
Perfect. Okay.
Just you, Samantha.
I'm sorry.
Okay,
Thank you, Matt.
Hey, and anybody that has a camera, feel free to turn on your camera. I don't care if you're sitting in your snuggie at home on the couch, feel free to turn on the camera. It's easier for me when I actually have faces to look at. It's hard enough online. And, if you're in your snuggie, that's fine. Fridays for me is a no tie day and it's a no shave day. And that goes back to my days as an OT. And when people ask what I am, I say I'm an OT. And when people ask what I do, then I sound pompous and say I run a hospital. But really, I identify as a therapist still, and that is largely due to the experiences I got at Temple twice. So I'll explain a little bit about myself and just my path. And with all the people on the call, obviously everybody's is going to be different. But I'll just talk a little bit about advanced degrees and professional growth for you. And then I'll actually turn it over to Abby and Michael, who have real knowledge to impart on you about the concrete steps. I do have an undergraduate degree in business with a concentration in marketing from Millersville University. Why I chose marketing? I come from small town, mid-central Pennsylvania. You either went to school for business, science, or teaching. I wasn't smart enough to go for science. I didn't think I really wanted to be a teacher, so I chose business. I chose a marketing track because when I was 18 years old, I thought that would be the easiest one to get through in 4 years. So working a couple years, I decided working in a cubicle, I was not going to be rich. And just briefly, and if you know exactly what you want to do for the next 40, 50 years of your life, you can click off now, wait for a couple minutes and let Abby and Mike talk to you. Everybody else, hopefully this resonates with somebody. If you asked me what I was going to do when I was 8 years old, I would have said a cowboy. If you asked me when I was 18, I would have said I'm going to be rich. At 22, 23, I think I want to be an OT. At over 50 right now, I don't know what I want to do 10 years from now. But I got to tell you, it's fun to try and figure it out. So the way it worked for me, went back to Temple, received, and I have 2 3/4 degrees. I have an undergrad in business. And then from Temple University, I have a certificate in partial fulfillment of a master's of science in occupational therapy. Try putting that on a resume. And then I also have an MBA, which I picked up while I was working at Temple. And the reason I have a certificate in OT, and I think this is important, to be in occupational therapy, and we're going back almost 30 years now, I didn't need a master's degree. I didn't need a doctorate. To do my basic job function, I needed a certificate in OT. The only difference that separated me from the people that got the MS in OT, the master's degree, was they spent another year doing a research project and presenting a thesis. I never had, nor do I have any desire ever to do research. It's just not my thing. It is for a lot of people, it's not mine. Definitely going on for a doctorate in OT where I could teach someplace. I didn't see myself in an academic setting. So I said to myself, what is going to make me grow in my profession as an OT? So I started working towards becoming a certified hand therapist. Went to an outpatient clinic, got some great experience, went back to Temple University. I was working there for a while. I left, I came back. And at that time, Temple was kind enough to have a very good reimbursement package. So I said, I'm going to pick up another degree. And everyone said, are you going to finally finish your master's? I said, no, I can be an OT for the next 50 years with what I have. I want to do something else. So I figured what would interest me. And I still had an interest in business. So I went to the MBA route, picked that up overnight. From there, I started working in management jobs, director of therapy. And from that point, I was working for some troubled hospitals. And what would happen is somebody would leave, a director or manager would leave, and they'd say, hey, Matt, we need you to take over this department. Hey, Matt, we need you to take over that department. And I would take them over. And I think one lesson that I've learned along this journey is every time I was asked to take on an additional role, an executive had given me this advice: don't ask for more money, And I hear that frequently now. To grow in a profession, do it because you want to do it. The minute someone says, are you going to give me an extra $2,000 a year to take on this additional assignment? Or other people construe that to be, you're just doing it for the cash. Do it because you want to grow in your profession, and it will all kind of work out. So what happened for me is I took on additional roles. And at one point, someone said, hey, we can't have directors reporting to you. You're still a director yourself. Guess what? Your new title is Chief Operating Officer. I said, great. Does that one come a little bit more money? And they said, no. Think of it as a highly paid internship. So here I am, the lowest paid COO in the state of Pennsylvania, but I'm learning at a small hospital, Roxborough, learned every department. And then that led to another company recruiting me to come work for them. And then that led to that company saying, hey, you're doing an okay job. We'd like you to be a CEO at this other hospital. And from there, it just became, hey, we're going to give this guy that's an OT an opportunity to run hospitals. So for the past 10 years, I've been at some level, some executive level at numerous hospitals, all in the Philadelphia market. And that's kind of been my path. And what I would say to those of you on the call, and we only have a couple minutes, I'd say continue to grow for growth's sake. And if you want to pursue a degree, do something that's going to round you out as you. 25 years ago when I started this in healthcare, we were using pen and paper for our notes. We didn't have an electronic medical record. Back then, physicians ran the hospitals. Now it's a lot of finance people run the hospitals. And this thing called COVID, 18 months ago, I didn't know what COVID was. And it's completely racked the healthcare world. And for people in this profession, when I say this profession, I don't mean OT, I mean healthcare. Think of it as a football team. There's 11 offensive positions, 11 defensive positions, but you're all football players. In healthcare, you need to know what your colleagues are doing in the department next to yours. That's the only way that you can really understand how this all works together outside of your little world. And if you want to be an OT or you want to be a PT or whatever your specialty is, and you want to work in that singular role for the next 40 years, then have at it. And that's great. And there's nothing wrong. But if you feel at some point you want to advance, then continue to learn just for learning's sake. And I'll say this, by no means, I'm not a dumb guy, but I'm definitely not the smartest guy in the room. And there's this Roman philosopher, I don't even know his name, but his quote is luck is nothing more than preparation meeting opportunity. And when you can take your experiences and your education and your core values and your goals, and those are going to change as circumstances change over the years. Those will change what your goals and expectations are. Being as well-rounded as you can will take you so far in life. And I don't know if anybody's in the second breakout session when John Kirby will talk about mentoring. He was a mentor of mine, and making those connections in the business community, but are huge, or in the healthcare community. So I'm up on my time. I know I had 7 minutes. So I will turn it back to Samantha to introduce the next speaker. And I hope somebody, at least one person, got a little bit of value out of what I said. And I wish you all the best. Thank you.
Thank you, Matt. Wow. I know I'm certainly taking plenty of notes. So we are really excited, and it looks like many of our students here are too. So thank you for taking the time to share a bit about your professional journey. And we really like what you said, especially about luck is where opportunity meets preparation. And I think that speaks to sort of why everyone's here today. And we're really excited about it. So thank you. Next, I'm really happy to turn it over to Mike and Abby, who will, now that we've heard kind of how education, where it fits in your professional world, we'll now think about the tips for selecting the right school and program, as well as navigating the graduate school application process. I also wanted to remind everyone we did have a little bit of time at the end built in for questions if you're interested. So if you have questions for Matt, feel free to start putting those in the chat. And if we go over a little bit on time, we have some time built out for that too. So thanks, Mike and Abby.
All right, thank you, Samantha. So I'm just going to share my screen here. This is the professor and me. We can't do anything without slides. So I'm just going to share this real quick. What Abby and I are going to do today, and I think Matt provided us with a great kind of foundation to talk about, how the rubber's going to meet the road here in terms of, all right, you need advanced education. What should that look like? And what are some things that you should consider? And so Abby and I are going to split this up. I'm going to take a couple of minutes to talk a little bit about some major considerations that you should have in pursuing graduate school. And then Abby's going to talk a little bit about the actual application process. And so I think, again, Matt's presentation really provided us with a good way to consider this first slide. And it's actually almost like we planned it a little bit. But, in terms of considerations for graduate school, I think very often people are going to start talking about, I need an online program, or I need an online program. I need to consider what to do in terms of price, but really what we want to do is talk a little bit about kind of what's going to be expected from you in terms of your organization. All right, sorry about that. My computer was freezing a little bit. But, when we're thinking about graduate school, we're really thinking about where you are in your career. And everybody kind of has the same career continuum, regardless of kind of what field you're in. Whether every field that you're in is either going to have an entry level all the way through that C-suite. So kind of where Matt is right now in his career, looking at that C-suite, that chief operating officer, chief executive officer, but really thinking about kind of what is going to be expected of you in the workplace should kind of inform what kind of degree you're looking for. And so, when you're first coming out of, when you're first trying to get into a field or a career path, really in terms of what the workplace is going to be expecting of you, it's kind of technical mastery, right? And so even looking at kind of Matt's career to kind of get into healthcare as an occupational therapist, it's really about being a technical master. I know how to do occupational therapy. I know how to provide therapy to an individual. I know how to operate in this clinical setting. But as he advanced in his career, different things were being asked of him. Instead of just being an individual contributor, working with individual patients, as he grew in his career, the team's asking him to run a team. The organization's asking him to run a team. And so he starts needing to connect all the dots between seemingly disparate areas to execute on specific initiatives or in specific projects. And then, of course, as his career advanced, he's being asked then to, be a chief operating officer or run the facility from an operations perspective. And so that's going to require a lot of strategic decision making. And so I know this seems really conceptual and all of that, but where this is going to apply for somebody looking for grad school is start by thinking about what kind of program you need based on what's going to be expected of you in the workplace, right? So I'll give you kind of an example of what I'm talking about. If you're 22, 23 years old and you're saying, no, I want to go get an executive MBA because I want to be in the C-suite, unfortunately, I don't think a lot of places are going to be looking for a 22, 23-year-old to take on a role in the C-suite, right? So that executive MBA is maybe a little bit beyond what you need at this point in your career. And so thinking about where you are in your career should really inform what kind of degree you're going for and kind of what that degree is designed to do. So based on whether you're career pivoting or just trying to get into the field, do you need technical mastery, tactical expertise, or strategic decision making? The best way I like to think about this is when you're in the job, are you going to be expected to know the answer to the question, or are you going to be the person that needs to know what questions to ask? And so that's going to be a really big thing that should inform what kind of graduate degree you're looking for. So, again, we're talking about biggest things to consider. It shouldn't just be kind of program format. It shouldn't just be, program price. It should be really from a content standpoint, what is it that I need right now? The other thing that we would want a student to consider is timing, right? And it's always the question that you need to ask yourself. It's the right question to ask yourself before you certainly start submitting applications for graduate programs, but is it the right time for grad school? And I know having spent 10, 15 years working with graduate admissions and graduate recruiting, I know when we start asking these questions, a lot of these kinds of things come up. Well, I'm looking for a new job, or I might get a promotion, or I'm having a baby. I don't really know what I want to do with my career, or if I want to still work in this field. Do I still want to work at my current company? Or there's a lot going on right now. Things are going to calm down in 6 months and I'll do it then. Or I might be relocating. So the question really then becomes, is it ever the right time for grad school? And so the point I want to make on this slide is just making sure that you are taking things into consideration from a timing standpoint, but never confuse taking things into consideration for what could be just excuses. Because if we're being honest with ourselves, there's never going to be a perfect time to go to grad school. The stars are not going to align in any way where it's going to be super easy to pursue a graduate degree. Oftentimes you're going to be working while pursuing a graduate degree. You're going to have family, spouses, kids. You're going to have things going on at work. There's never going to be a perfect time. Certainly there are going to be times that are better than others, but we certainly don't want anybody to use anything up here necessarily as an excuse for kicking that can down the road. Oftentimes these are things that you can and should ask an admissions counselor as you're working through a graduate application. How flexible is the program? How many hours per week should I really reasonably be expected to set aside for homework in class? And let me figure out how I can make that work with my home and my job. But these are all things to keep in mind, because again, there's never going to be a perfect time, certainly, but there will be times that are better than others. And the last thing I wanted to talk about, and this is one that's not usually always obvious to students as they start thinking about pursuing graduate education, and that's kind of the idea of thinking about your stakeholders. And so this, if you've taken any business courses, this might be something that looks really familiar. This is a very classic stakeholder analysis grid, basically trying to figure out how you're going to manage everybody that may or may not be involved on a project or a decision. And I actually like to use this in talking to students because I think this is a good grid you should jot out on a pad of paper to start thinking about who do I need to be talking to before I pull the trigger on this graduate degree? Because oftentimes, and I've seen this many, many times, the hardest part about starting grad school isn't always just getting in. It's getting the support you need and all the stakeholders in your life and your job to support you while you're doing this. And so that's a critical thing that people just too often assume they have, that everybody's just going to rally around them and support them to go to grad school. But that might be possible, but you'll need to have conversations to ensure that and actually manage this process. So again, a classic stakeholder analysis grid. You see the interest from low to high there on the vertical axis, and then influence in terms of how much influence the stakeholder might have in your decision or in your pursuit of the graduate degree from low to high. And so this is kind of where we break down what do we need to do and who do we need to talk to. I'll start here with those that have the highest amount of interest and potentially the highest amount of influence. Certainly conversations that you want to have with spouses or partners. Any graduate degree might be requiring you to carve out 10, 15 hours a week beyond just what's going on at home and beyond what's just going on at work. So spouses and partners could be really critical in this decision and your ability to get through. Supportive supervisors, I know that seems like a weird qualifier, but supportive supervisors, meaning supervisors that actually want you to get this done. You'll want to manage them because they have a high level of interest. They have a lot of influence in the kind of degree that you can and should be getting. And also your mentors, any mentors that you have professionally, kind of talking through what this graduate degree experience is going to look like. Those that have really high interest, but maybe not a lot of influence in terms of your graduate education might be your parents. Certainly if you still live at home, they might still be supporting you in some ways financially, or maybe they're just helping you in terms of housing. But having these conversations if your parents have a high degree of interest and some influence. Team members or anybody that's directly reporting to you in your job. These are conversations you might have like, hey, I have to hop on to a project meeting during my lunch break, so that's why my door's closed, those types of things. Having conversations with roommates, certainly if you live with people in a roommate situation, if you're going to be going to class or you're going to have to be doing a lot of things at the house, these are conversations that you want to have prior to applying and starting that graduate degree, just to make sure that it's a good experience. Those with a lot of influence, but maybe not a lot of interest, this is always kind of an interesting group of people. You know, supervisors. So if you're in an entry-level job, your boss's boss might have a high degree of influence because they're your boss's boss, but they probably don't care a lot about you pursuing a graduate degree, but you know, still somebody to manage and maybe have a conversation with. If you have children, this is certainly something that you want to talk to them about as well. Again, a lot of influence because you have to manage your children, take care of your kids, but they don't necessarily have a lot of interest all the time if you're going to grad school. So again, thinking about these conversations. And our last group here, those with really low interest and low influence, but maybe you still have to talk to them. Coworkers, certainly coworkers in other teams, anybody that you work with directly on a daily basis, acquaintances, you know, people that are just going to ask, hey, what are you doing with your grad degree? You know, there's still stakeholders in your life, and conversation certainly might need to be had. So again, a classically oriented stakeholder analysis grid, but even if you don't use the grid, I think it's just important to remember, as before you begin the actual process, really lining up your stakeholders, really lining up your support for pursuing a graduate degree, I think is going to be really critical in your success in the graduate degree. So in terms of things to consider, just thinking about that entry level, you know, technical mastery, tactical mastery, strategic decision making, certainly timing, and these stakeholders. The last thing I'll say, and Matt actually kind of opened up his part of the presentation with this, was simply to say, hey, if you know exactly what you want to do, you know, just pop in and talk to Mike and Abby about this. And I will say, to wrap up kind of what to consider for grad school. Grad school is very much a very focused endeavor. And so I'm glad Matt kind of teased that a little bit, because graduate school is really about you've discovered exactly what you want to do. As I always tell students as we talk about grad school, one of my first questions is, why are you pursuing a graduate degree? Why do you think you need a graduate degree? And if there isn't a good answer there, I'm going to be very candid with the student to say, you know, it doesn't sound like you know what you want to do. And I will tell them that there are actually way easier and less expensive ways to explore different fields than going to get a graduate degree. Graduate degree is expensive. Graduate degrees are hard. They're challenging. And so the only way, and they're certainly not long enough for you to kind of taste everything like you may have in undergrad. You know, an undergrad degree is 4 years. You can kind of try everything on, dip your toe in the water and a lot of different things. But with graduate school, we might have you for a year, maybe 2 years. That's not enough time to kind of figure things out or discover yourself in a lot of ways. Not to say that there's not going to be a lot of self-discovery in a graduate degree, but it is a very focused, very kind of tight rope walk when we talk about pursuing that graduate degree. So all things to consider, and I hope any of this or all of this hopefully was useful as you think about preparing to apply and search for graduate degrees. With that, I'm going to hand it over to Abby Shepard, who's actually going to talk about the actual graduate applications then and some things that you want to consider about getting together as you prepare for that. And Abby, I'll just advance your slides if you want to just give me a heads up. So thank you all.
Yeah, awesome. Thank you so much, Mike. So Mike spent a lot of time kind of focusing on some of these kind of broader considerations, right? And Matt provided a really wonderful case study of someone's example kind of through the education system, through graduate school, and also their career. So what I want to do is kind of get pretty nitty gritty here. I realize that many of you on the webinar today might actually be at the point where you are starting to do your graduate school research. So perfect. We'll start with some general guidelines kind of for your search. Again, some of these might seem a little obvious, but I think as I think Mike teased a little bit here, when you're considering all of these different factors, there's a lot up in the air that you're kind of considering, right? So I do think it's really important to start your search early. Every single graduate program, different schools are going to have different deadlines, potentially multiple intakes, and you want to definitely make sure to give yourself enough time to prepare your application ahead of that deadline. and kind of work backwards from there to figure out, when you might need to, do certain things for the application, or maybe when you need to reach out to an admissions officer, right? That's my second tip here. And maybe it's a little bit biased, right? I've worked in graduate admissions for a long time, and a lot of what I personally enjoy doing is working with students. But I think you'll find as you're doing your research, most university and program websites are going to provide some basic information, but where you're really going to get into the nitty gritty, the mission of the different institutions that you're applying to, what makes one MPH program different from another, is in those one-on-one conversations. I know here at the College of Public Health, we take a very counseling-based approach to admissions. And we meet with students to go over their background, to go over things like their resume and their transcripts, and really providing the support so that a student can really submit the strongest application possible. We know that that's not always necessarily available to everyone for those one-on-one appointments, but you can really find out a lot more about different programs by signing up for admissions related events, right? These events typically, especially now with COVID, are online, they're pretty accessible, and they vary quite a bit, right? From just general overviews of a program to sample classes. And they really give you a lot of wonderful information about the programs that then you can kind of take with you and use in your application. And finally, you do want to cater your application to every school that you're applying to. Again, this might seem very straightforward, but as someone who's worked in graduate admissions for quite a while, it is very easy to spot what a student writes, kind of a general essay, and then they just switch out the name of the school. You really want to make sure to kind of include that detail, right? And really take the time to cater parts of your application to each program that you're looking at. So the last thing and I'm wrapping up a little quickly because I know we're running out of time here a bit, but I do want to give some general application tips. So most applications, right, are going to, into any program that you might be looking at, are going to have kind of the same or similar features to them, right? Letters of rec, essays, transcripts. These aren't going to really change program to program. But I think the way that students approach these sections can optimize their application. And what I mean by that is kind of in my first example here for letters of recommendation. We see all the time kind of generic letters of recommendation coming through. And so it's very obvious to us that a student might not have necessarily had an in-depth conversation with their recommender. And what I mean by this is typically, if you're going to ask someone to write a letter of recommendation for you and they say yes, it's probably going to be a good letter of rec, right? 9 times out of 10, the letters of rec that we get are positive. Where I think a lot of times students might miss an opportunity is, when you're thinking about your recommendations, right? Why are you asking this person, right? What skills do you want them to talk about that you definitely want included in your application, right? If you're talking to a faculty member, maybe there's a project that you did that really, enhanced your writing ability or set you on the path to pursue an MSW, right? We want that to be in those letters of recommendation. The more detailed, the better, right? When looking at essays or personal statements, I think, again, the more detailed and the more it's obvious that a student has done their research and has tailored the essay or the personal statement to that institution, the better. A lot of times, in admissions, we talk about, reviewing students and making sure that we're a good fit for them. And the essay is really the chance for us to kind of get a little bit more information about you from your own words. Standardized tests, I'll touch on very briefly. Some programs require things like the GRE, some don't. I always tell students that if you're applying to a program that does require the GRE, to make sure to utilize some of the free resources that are online through ETS, which is the organization that administers that exam. Take time practice exams. I know they're scary to do because that score that you get might not be what you want, but you can use that to then kind of prepare. I know it looks like we're running out of time here. I guess I'll just leave it out. I'm sorry I went over a little bit, Sam. I guess if anyone has specific questions, I know myself and Mike are always available to kind of answer those.
And we will, thank you so much. We will also be, we've recorded this and we'll provide all of this information to everyone who is able to attend and anyone who couldn't attend, but that hope to attend and get this information as well. This has been so informative, and I think, you know, that's the challenge of wanting to provide so much resource to our students. So thank you so much to all of our speakers as we've gone through career paths, what the graduate education process might look like, and as well as those practical tips for getting started. So I want to thank you all so much.
So hello and welcome to the session, Kickstarting Your Career. This session will help participants learn why it's important to research organizations before applying and where to look for information. We'll also cover weighing compensation when making career decisions and explore approaches to social networking and ways to effectively cultivate professional relationships. To help lead this discussion, joining us are three remarkable alumni leaders. We have with us Marvin Nichols. He's the Practice Transformation Specialist at Quality Insights. He's also a member of our Alumni Association's Board of Directors, as well as co-chair for our Professional Development and Mentoring program. And then we also have with us Chris Barnett. He's the CEO of ICBD Holdings, LLC, and actually the CEO of a number of businesses, and I'll give him the opportunity to tell you a little bit more about that. But he's a very important board member, and he serves on the Dean's Advisory Council, which is also known as the Board of Visitors, and we're so happy to have him with us this morning. And last but certainly not least, we have Janelle Lyons. She's the Director of Social Services at Caring Heart Rehabilitation Nursing Center. She's a two-time alumna and also serves as Vice President for the inaugural Board of Directors for our Alumni Association. So great to have each of you with us and to have the opportunity to hear from you about what's important and how our students can be best positioned for success going forward. Before we dive in, I'd like to give each speaker, beginning with Mr. Barnett, briefly an opportunity to briefly share a little bit about yourself and your career, what you do. It's not necessarily intuitive based on the name of your organization, and so feel free to take a minute and share a little bit more about yourself.
Sure. So my name is Chris Barnett. I am the CEO of ICBD Holdings, which is not indicative of what we do. ICBD Holdings owns or manages a number of assets across 3 different states in everything from autism clinics to psych outpatient offices to substance use disorder outpatient clinics to sober living homes to mental health outpatient clinics, MAT clinics, and we're within the New England region, Tennessee, and Florida also. And so it's a really long explanation to say that, like, we try to help people that have mental health. We're in the mental health space and we try to help people. We have roughly 200 employees. All of my companies are in one way or another a version or an iteration of a startup. So I do startups. I'm a serial entrepreneur for 20 years, primarily in the healthcare space.
Thank you so much, Chris. Marvin, do you want to go next?
Sure. Thank you, Natasha. Hi, everyone. My name is Marvin Nichols. I am a practice transformation specialist with Quality Insights. And what that means is that I routinely work with doctors' offices in the states of Pennsylvania, New Jersey, Delaware, and West Virginia to transform their offices into more of a team-based care or value-based model. I typically have about 500 or so practices that I work with from year to year, and I've been in the healthcare field for about 20 years. I graduated from Temple with my bachelor's of public health in 2014, and I have a master's in health administration, and I'm also a veteran. Thank you.
Thanks for your service on so many fronts, Marvin.
Thank you.
Also Janelle.
Thank you, Natasha. Hi, everyone. I'm Janelle Lyons. I'm a licensed social worker, and I am the Director of Social Services at Caring Heart Rehabilitation and Nursing, which is a 250-bed rehab facility with long-term care units as well. I work a lot with community organizations to build relationships and with hospitals to ensure that we have safe discharges for our residents and that we can transition people back to the community. We often get a lot of Temple interns from the undergraduate and graduate program that we love. I graduated from Temple with my undergrad with my College of Public Health degree, and then, my public health degree, I'm sorry, from the College of Public Health, and my master's degree was in 2015. Thank you, guys.
Thank you so much, Janelle. Before we transition to some sort of early questions to get the conversation going, I just wanted to thank Amani for having the valor and putting herself on screen on video. We do believe that that will offer the best experience for this chat since we can't do this in person. So if there's others that are sort of on the fence with turning your video on, now would be the time. Thank you, Raina, and hopefully others will join. So why don't we get started? I'd like to start with Marvin, if that's okay. Marvin, can you start talking a little bit about organizational research and why it's important? And there's certainly, we'll start with Marvin, but if Chris, you or Janelle want to weigh in here on this topic too, you're more than welcome to. But it's important. We know it's important to look up organizations before we work for them. And so what's the best approach? What kind of recommendations do you have, and where to look? Where would you send people to look? There's a lot of information on the internet, right?
Right, absolutely, absolutely. And it's very important for you to do the research on the organization that you're going to work with. So I just developed here about 10 tips, real quick and easy. Tip number one, just look for organizations that share your values. Everybody heard of Indeed.com. So Indeed.com did this survey, and out of 43% of the candidates say that they're attracted to a new job because of meaningful work. By researching the organization's core mission and values, you're not only ensuring that you have clear goals, but ones that resonate with your interests and passions. For example, if you value social causes, diversity initiatives, or innovation, choose an organization that aligns with these values that you have. Use resources such as organizational pages that you can find on the internet and Google that offer detailed information about the organization that you're researching. And read reviews from past and present employees covering areas like organizational culture, salary, job advancement, and work-life balance. Tip number two, research employee benefits that the organization provides. To attract potential employees, organizations often disclose healthcare benefits and other perks, including stock options, flexible work schedules, or unique on-site facilities that may include gyms or cafeterias. Especially in light of the pandemic, a lot of organizations are going to telework. So make sure that you research those type of benefits as well. In addition, there are always careers and about us pages that exist on the internet that you can evaluate an organization as well as their social media channels. Another tip number three, is to learn about the organizational business operations. How does the organization make money? Is the organization a startup? Or has it been in the business for a while, and how has it grown over time? What industry is the organization in? The answers to these questions will give you an idea of how stable the business is, what some of the immediate concerns might be, and how you could play a part in that success. For public organizations, you can get this information from organizational websites and Google, as well as accessing certain financial information. Public organizations typically post annual reports, strategic plans, and other public financial documents online. When you're reviewing, look out for information that will help you answer questions about the industry and how the industry you're researching could pull ahead or maintain its lead in that space. Tip number four is to research the organization's leadership. When an organization captures your interest, you should get to know who is leading the way. You can seek out social media profiles of executives and department directors. Some of the questions you can ask are, what are the posts like? or they're proud to represent the brand or organization. Some leaders may have been interviewed or written books or articles that maybe give you an insight into what they're thinking. Tip 5, expand your research to news and recent events. It's a good idea to scan headlines for major changes in the organization you're researching. Note any significant events such as widespread layoffs, corporate mergers, buyouts, transition in leadership, etc. Such changes can bring opportunities, but also could result in low employee morale and produce a volatile work environment. And proceed with caution. Always check more than one source for information. Tip number 6, ask your network for opinions. Seek opinions from trusted, reliable friends and associates. After you've done your research, discuss what you learned with your network. Ask people you know for the inside scoop on their organizational culture and if there are opportunities. If you're a recent college graduate building your network from scratch, like most of you guys are, ask university advisors for names of alumni working at your target organization and consider reaching out to these people. Tip 7, set aside time necessary to research properly. It's important to note that this research does take time. If it's not possible for you to set aside several hours to do this research, just break it up into like 20-minute blocks. But it's important that you reserve that time to research the research organizations that you're interested in. Tip 8, understand the type of organization that you want to work for. If you're a new college graduate or in career transition, you may want to start by building a list of industries that suit your knowledge, skills, and interests. Indeed.com has an excellent resource that shows the best places to work. You can navigate by industry and organizational ratings to find a variety of organizations that will fit your new goals. Tip 9, be strategic in how you research in an interview. After learning all you can about an organization, you may be tempted to showcase that newfound information, right, during that interview. But be sure to do so strategically and to your benefit. For example, you can use the information you've learned to connect your skills and experience to the job description, the goals of the department, and the vision of the organization throughout the interview. Organizational research is time well spent for developing knowledge of an organization, preparing for interviews, and writing an eye-catching cover letter. It also helps you make an informed decision about whether an organization is a good match for you. And finally, tip 10, these are some questions you might ask yourself while you're researching the organization. Does the organization appear to be able to attract and retain talented people? Is there a high turnover rate? And if so, do leaders or staff seem to be concerned about unusually high turnover rates? Or are turnover rates in line with position norms? Do professional development opportunities appear to be available for employees? For example, do leaders give people working below them responsibilities outside of their job descriptions? Do staff members receive on-the-job training and mentorship? Is there an established employee performance review process, and are there opportunities for upward feedback? Does the organization follow up on performance reviews and feedback? And do staff appear to be inspired by organizational goals and its leadership? Does the organization have the capacity for change? And is there evidence that the organization monitors or course corrects when implementing changes? So those are a few tips that I can share with you guys about organizational research.
Marvin, thank you for that. That was a lot to take in, and fortunately we're recording this session, and if I were taking this advice, or a student getting ready for the workforce, I would have to review this a couple of times to make sure that I captured it all. But thank you so much. There'll certainly be an opportunity for questions. I just want to remind everyone that if you have questions, we will have a Q&A at the end. You can post them in the chat. You could also use, there's a reactions button at the bottom of your screen you should see. If you click on that, there's a raise your hand feature. You're welcome to use that feature as well. Or the other reactions, if you hear something you really like or agree with, feel free to give us a thumbs up or and applaud. So I want to transition to Chris Barnett now, because we had conversed a little bit about what, he might share, and he's a wealth of knowledge also. And one of the things that came up that's, I think it's tough for people right now, considering, it's not just about getting a job anymore, but there's a social responsibility for people in the health professions and public health professionals and social workers. And so does money matter? So if we can maybe talk a little bit about right now, weighing compensation when making decisions, and maybe start with what factors, Chris, should one consider while making career decisions?
Thank you, Natasha. I'm not a huge proponent of giving advice, but what I can share with you is my experience and what's worked for me. And I could share with you what hasn't worked for me. And so, spoiler alert, in the beginning, money shouldn't matter. Well, who's this guy in this fancy suit telling me that money shouldn't matter? I'll tell you who this guy is. So I'm a guy that grew up, I grew up poor. I coming home and there's no electricity. Neither of my parents have a college degree. That's who I am. And so how do I go from there to where I'm at 37 years old? Because I'm very fortunate in my career. And the way that I did that is not by happenstance. It was with goal planning and methodical decision making. And so my first suggestion and what I did and worked for me is I started with an end in mind. What was my goal? What's my end? Where is it? Because you can get lost in the reactive decision making if you don't have that goal in mind. And so for me, I wanted to be a successful business person. Neither of my parents went to college. I sit here with a JD. I'm an alumni of Temple. Already, I'm taking a divergent path. So I wanted to be a successful business person, but where I grew up and how I grew up, I didn't even have access to successful business people. And what I found in my career is that people with the success that I wanted, they think differently, they act differently. They analyze problems differently, they reshape them differently, they interact with others differently. So how do I learn all that? I read a lot of books, right? I read a lot of books. Let's start there. Still wasn't enough. So what I did is at 18 years old, I made a decision to leave my six-figure job. I was really good at sales, so I was doing well. I left my six-figure job for $400 a week. That's crazy, right? It's crazy. The reason I did it is because it gave me the three aspects of compensation that I would suggest to everybody, which is knowledge, experience, and access, with the emphasis on access. So I found a 62-year-old real estate developer, and I identified that I wanted to be in real estate development. And I said, and I proved myself invaluable to him. I told him how smart I was and how hard I was going to work, and I showed him. And he gave me a shot. And in order to be in real estate development, you need two things. You need capital and you need knowledge. I had neither of those, right? So I got myself in the room, is what I did. And I sponged it up. I understood at 18 years old that my compensation had nothing to do with my paycheck at the end of the week. Have you ever noticed, as silly as this is, have you ever noticed how business people sit? They sit with their legs crossed a certain way. I come from a family that we didn't cross our legs, right? But when I sat in enough meetings with enough successful people and I noticed that all of them were sitting the same way, I started to cross my legs the way that they cross their legs. And for years, it was uncomfortable. For years, it wasn't natural. And it's now natural. But something that simple, if you want what they have, do what they do, right? So I got myself into the room, and then I started learning and learning and learning and learning. So my suggestion is to you is to start with an end goal in mind. If you're graduating with an MSW degree and you want to be a clinical director, that's your goal. Every career decision you make, and you're going to have a lot of decisions that come at you at all different times, every one of them should be passed through the litmus test of, does this get me to my goal, right? And so if you're you want to be an expert clinical director, you're going to need to start with experience. So when you go in those job interviews and you get two jobs offered to you, and one of them's at that for-profit and they're going to pay you $55,000 a year, but the other one's at the non-for-profit and they're going to pay you $40,000 a year. But the non-for-profit's going to give you a caseload of 200, and the for-profit has a boutique program. They're going to give you 12. Keep in mind what the goal is. Now, listen, we all like nice things. But because you're graduating college, I have to assume that many of you have survived on ramen for at least a few years. If you make it your goal to get to where you want to get, and that involves another couple of years of ramen, don't sacrifice short-term Don't take short-term gains at the sacrifice of long-term gains. That's my suggestion. Be prepared to sacrifice. So compensation really shouldn't matter. So what I would suggest, what I did is I identified my needs and my wants, and they're vastly different. And in the beginning, as long as my needs were met, I'm not suggesting anybody be homeless or go without food, but as long as my needs were met, the litmus test was, is this going to get me to the point that I want to end with in my career? And in my experience, when they asked me to speak on this topic and they wanted me to, I said, I don't really have a lot of experience getting jobs. I'm sorry, I don't. I have a lot of experience employing people. I've employed thousands of people over my career. So I'm kind of coming to it from a different aspect. And what I can tell you is that the most successful people within my organizations, when you look at their CVs and their resumes, it was methodical moves. It was methodical. It wasn't, they didn't leave because they got this bump here. And then, 6 months later, they got an opportunity for another bump. They set out their career goal in the beginning, and they made it their mission to effectuate the action items that would get them to their results. So put some thought into it. And so the last thing I want to address is mentorship. I cannot tell you how valuable mentorship is. And I can also tell you that you should never, ever underestimate the immense egos of successful people. And so what I tell my kids and what I'll say to you is closed mouths don't get fed. All you have to do is ask. Hey, Marvin, I love the work that you're doing and it's so impressive. And I got to tell you, I've dreamt about doing that kind of work. I'm wondering, I know you're very busy. Could you make any time to mentor me? Even if it's 30 minutes every 2 weeks that I can just call you and ask you some questions. People want to help in my experience. They want to help, especially people like me, right? So I come from nothing and I am where I am. I feel it's my duty to give back. It's my duty. I learned a lot of things the hard way and I want to help those that are endeavoring on their career path. As long as Marvin alluded to, as long as our culture is similar, right? So if you tell me all I want to do is make money, I'm probably not going to make a lot of time for you. But if you tell me I want to get fulfillment in a career that's going to help others and I want to be in a position of power, not because I want the power, but because I want to be able to change people's lives, and including those that work for me, man, I'll buy into that mission, right? And I think there are a lot of people like me out there. And so my suggestion is find a mentor. Stop thinking purely about compensation. Don't cost yourself a long-term career over an additional $5,000 right now. And I know it's tough. You have student loans and you're finishing college and you're tired of struggling. And I get it. I get it. I've been there. I'm not coming from a high perch, but I can tell you that if you make the long-term decisions, in my experience, you'll have more fulfillment in your life. So I think that's 7 minutes.
Chris, yeah, no, that was phenomenal and very powerful, and I'm sure a lot to think about for everyone participating. I want to transition now to Janelle. Janelle, we had asked you to talk on how to best leverage social networking and what approaches you could take. Like Chris, for example, Chris says, I'm open to mentoring. I would jump at the chance to help students or young alumni early in their career that want to change people's lives, that want to help, and that want to do something that's bigger than themselves. And how, what's the best approach to cultivating these professional relationships? So maybe we could start with maybe just talking about the LinkedIn, for example, as we know that's a great platform, and then you can take it from there.
Sure. So leveraging social networks to cultivate your relationships is very important. I know that we have a lot of social media, a lot of social networks, and we're like, I don't want to join anything else maybe. But if you're not joining a network such as LinkedIn or the OWL network, you're doing yourself a disservice. So LinkedIn has over 760 million users. That's 760 million opportunities for you to connect with someone in your field. So some of the things that I like to do when I access LinkedIn, I start with looking simply for a search. You can search a hashtag that's related to something in your field. So I'm public health and I'm social work. I can search hashtag public health, hashtag social work. If I'm looking for a mentor, such as what Chris said, I can hashtag mentorship, and it'll show you posts and different people within your community. There are mentorship groups on LinkedIn that you can join. You can simply find them by searching mentorship. A great suggestion for using LinkedIn, especially if you are a student or an alumni of the College of Public Health, is to follow the Temple University College of Public Health alumni group. Join that group and follow the College of Public Health page. When you're looking for people in your field, a good idea is to send a connection request. It doesn't cost you anything. Even if you're nervous about connecting with people, simply sending the request is the first step to connecting with someone. Normally, when I send a request, I like to send a little follow-up message. Hi, my name is Janelle. I noticed that you were a part of this social work group in Philadelphia that I'm interested in, and I would really like to connect with you. Something simple like that is the first step in the door. Some of the professional groups related to your field on LinkedIn can also be very helpful. So if you are in the public health field, APHA is a great group to look up. If you're in the social work field, NASW is a good group to look up. So Chris mentioned having a goal and then planning for what's your end. So when you're searching for a mentor, you can find a mentor on LinkedIn. Before you reach out to a mentor, I want to stress it's very important to know what your why is. Please don't send a message saying, I would like to pick your brain. Pick my brain about what? What do you need assistance with? How can I help you? How do you see me fitting into your career goals? That's what I want to know if you're reaching out to me. So make sure you have your goal planned, make sure you have your why, and make sure you know exactly what you want to get out of the relationship when you're trying to connect with someone. Is there an area that you're looking to challenge yourself in? Is there a new skill set that you're willing to learn or you're looking to learn? Those are important things to let your mentor know. Well, your potential mentor know. So who is already in your network is very important. So I am more likely to want to assist someone who's already in my network. So you should start within your network. Are there people that you know? Are there people that you have interacted with? Are there organizations that you have worked with in the past that have potential mentors for you? If you already know the person, you increase your chance of getting a yes. So can you connect with people who you don't know? Of course. So if you want to connect with someone you don't know, again, don't go in blind. Frame the outreach around what you'd like to achieve and how you think the person can help you, and slow down to build the relationship. Some people may be wondering, how do I ask for a virtual cup of coffee? Okay, because we're in a virtual world now. You used to say, oh, you want to meet for a cup of coffee? Maybe we can meet before work, on lunch. We can't do that as much now. So how do we virtually meet for a cup of coffee? So a good way is to reach out to one of your connections and say, hey, I would like to, my name is Janelle. Say I'm introducing myself to someone. My name is Janelle. I see that you are a part of the Temple University Black Alumni Association. I would really like to meet with you to discuss some of the goals that I'm working on within CPHAA. I'm wondering if you have 15 minutes of your time to give me. Something simple, not a long paragraph, is a great way to start the conversation. So what do you do if the person says yes, and you're going to meet with them for this virtual cup of coffee? A virtual cup of coffee is best via video, in my opinion, but it doesn't have to be. It can be over the phone as well. So do some research on the person before you meet with them. See if there are some things that you have in common, some professional organizations, even things that aren't related to your profession. There are small ways that you can connect with people that don't necessarily have to be the exact field that you're in to help build that relationship. So you can review their website, you can review their social media to learn more about them, just so that you can reach that common ground. A great idea is if you have a calendaring system such as Calendly, so that you don't have to send messages back and forth about what time and date you want to meet, send them the link to your calendar. They can choose the date and time that's open in your calendar, and then the date is set. After you meet for your virtual cup of coffee, make sure you follow up with a thank you note. Thank you notes go so far. It does, me personally, it touches my heart when someone sends me a thank you for my time, because everyone's time is valuable. And your virtual cup of coffee should be the beginning of the relationship, not the end. So make sure you're keeping in touch and you're finding more ways to connect with the person. And that is a great way to help find a mentor. The OWL network is a great platform that you can use to also help build professional relationships. So it's for Temple University alumni, where they can connect with other professionals and students and people within their field. There are job postings on the OWL network. I think I found my first social worker from the OWL network. So that was pretty cool as a recent grad, a new alumni, to find someone who was graduating to be a part of my team on the OWL network. I think that we will be sending out instructions on how to sign up for the OWL network at the end of this presentation.
We certainly will. Thank you so much, Janelle. Again, more wonderful advice and great suggestions for our participants. I think now we can move to some general questions from those of you that are joining us. Thanks for the applaud there from one of our participants. We have a question here from Raquel that says, is it appropriate to have more than one person to mentor you or offer you professional guidance? Who wants to take that question?
I'll take it. I would say yes. Don't go overboard. Don't have 25 mentors, but if you have a few people who are experts in the different skill sets that you are trying to build or the different relationships that you are trying to cultivate, why not take everything that's available to you?
Remember, all of that will take work, right? Because you have to follow up with all of those folks.
That does take work. So make sure if you are accepting more than one mentor, you are able to appropriately communicate and follow up with them.
That's what I was going to say. I agree.
Yeah.
I think look for quality over quantity. Is it appropriate? The answer is yes. But I would, rather than trying to amass 6 different mentors, I would really do my research to find the 2 that I really want, because you might get diversified advice. And the reality is not all advice is good advice. And so I would identify the quality and understand that a mentorship relationship is a commitment of time, like Janelle alluded to with the thank you notes. And I mean, absolutely. So make sure you have enough on your schedule, enough openings in your schedule for as many as you're going to take on.
Right. And you know, career, it's a journey, right? Your career progression is a journey. So in that journey, you can come to that fork in the road. And sometimes, you know, where you think you might want to be changes. So, you know, it might be beneficial for you to like get another person's opinion or get another mentor. But like my panelists suggested, you know, 20 is probably a little bit too much, you know.
Great advice. I think we're fortunate to have with us this morning the president of our Alumni Association Board of Directors, and his career has been in the nonprofit world, and he did have something he wanted to add. So, Larry, can I wanted to give you a minute to just share.
Thank you. I'll be real quick, just going off of what everyone said. One thing I want you all to think about is the nonprofit world. It is a great career. I've been in nonprofit for, God, almost 35 years. It's a good way to learn because they will take you and they will train you and they will give you tools. So even if you stay with that nonprofit where, no, you're not going to make the world of money, but stay there 5 years, 6 years, get a little experience, and then you are so much more marketable to what you have, but at least you've been given so many different tools of learning. So that was the only thing I wanted to say, because a lot of people don't think about going into the nonprofit sector. Thank you.
Excellent. Thank you so much, Larry. Let's see, are there any other questions in the queue right now? Here we go. Emily, how can you leverage minimal experience in the public health field when speaking to potential employers? What is the best way to start from the bottom? That's a great question. Thank you, Emily. Who wants to tackle that? Chris, you hire, so.
Yeah, that is a great question. Nobody's hiring somebody at entry level expecting a lot of experience. So when you hire at entry level, you expect a good culture fit, a work ethic, and intelligence, cognitive ability. So I'm going to take some of the pressure off you immediately. You're not going into an interview and they're going to expect you. If you've made it to an interview, they know who you are. They've seen your CV. They've seen your resume. So that's number one. Number two, I think what Marvin spoke about with doing research. So the interviews that I'm most impressive with when I'm interviewing someone is when they can speak to my goals, to my corporate strategy and my goals. And it's easy. It's advertised on my websites, right? So to give you an example, we are the only provider in the world that I know of that is treating co-occurring disorders of ASD, autism, and substance use disorder. So we're doing some groundbreaking stuff there, which is an initiative of mine, and it's awesome, and I'm excited about it. And if you sit in my interview and you've scoured through enough of my websites and see all the blog posts and everything that we're doing about that, and you talk to me about that, I don't care what experience you have, because the success of my companies are predicated on the team that I can put together. And so there's a great book called Good to Great, Why Some Companies Make the Jumps and Others Don't. I will create a position for somebody that has that. If you have that piece, if you have that if you have that passion, if you have that ability to sacrifice, if you have that cognitive ability that you can tie what my goals are and extrapolate my goals for my websites, I will create a position for you. And I will make sure that you're under a manager that's going to groom you and grow you into the team member that I know you can be to add value to my organization. I think I answered it. I hope I did.
Yeah, no, that's some really great advice. Marvin or Janelle or even Larry, do you want to weigh in on this question or answer?
That was spot on. The only thing I would like to add is, let's just say if you couldn't create a position, if you do that research, it's going to resonate with that person that you're interviewing with, and they're going to tell somebody else about you. So definitely do the research, and you know that you might not get that position right then, but I tell you what, somebody's going to know your name by virtue of you doing that research and you making an impression on your interviewer.
Thank you so much. I want to again extend a really special thanks to all of our panel speakers. We're really so fortunate to learn from you, and I hope that every participant today felt good about what they heard. They got some nuggets that they can take with them and turn it into something really great. We know that owls fly and perseverance conquers, not to be cliche, but we are confident that everyone here today will do great things, and we're here for you.
Thank you. I know in our Pursuing Advanced Degree session, what great dialogue we had, and really eager to hear more about the Kickstarting Your Career session as well, because we just have a whole host of excellent panelists and speakers. So thank you all. Shortly, we will be moving into our next breakout room session. And in just a moment, we'll have the option again for you to select the session that you would like to attend using the breakout room session function at the bottom of the screen. And from there, we'll take a quick break, and then we'll begin the next session right at 10:30. So again, once you're in your correct breakout session for the room that you'd like to be in, please feel free to shut your camera off, put it on mute, and grab a cup of coffee or anything you might need, and we'll see you right at 10:30. Thank you. Okay, perfect. Well, welcome everyone. I'm very pleased to welcome you to the Power of Networking and Mentorship session at our Professional Development Symposium today. We have with us three outstanding presenters who are industry experts and have been doing work in this field, either through their professional career or as a part of Board of Visitors and Alumni Association initiatives at the Temple College of Public Health. So we're very excited to welcome them. I'm going to briefly introduce them because I know sometimes that can take up some time. So I will get started with that, and then we will begin. In the meantime, for these breakout sessions, if you would like to turn your camera on, we definitely welcome you to do that. But if you don't want to, that's fine too. So today I'm very pleased to introduce to you Lavelle Harmon. He is an accomplished executive with more than 20 years of experience in healthcare and nonprofit organizational leadership. He is presently principal of Harmon and Associates, where he draws on his operational underwriting background and extensive experience with Medicare Advantage and other health insurance products to guide clients in evaluating and implementing expansion opportunities. He formerly served as Health Partner Plan's Senior Vice President of Business Development and has proven expertise in development, financial and competitive analysis, forecasting, government relations, and regulatory compliance. Prior to joining Health Partners Plans, Harmon served as the Director of Government Sales for Health America, and he also has held leadership positions at Centene Corporation, AmeriGroup, United Healthcare, AmeriChoice, Universal Community Homes, Philadelphia Development Partnership, Independence Blue Cross, and Keystone Health Plan East. Harmon received a Bachelor of Business Administration, a Master of Business Administration in Health Administration, and a Master of Science in Healthcare Financial Management, all from Temple University. Thank you, Lavelle, for being here. Next, I'm pleased to introduce Brian Lindbergh, Executive Director, Consumer Coalition for Quality Healthcare. As a Temple undergraduate student, Brian Lindbergh was gripped by the possibility that social work embodies for creating change and improving lives. He was fortunate to have a mentor, the late Kurt Leonard, Dean of the School of Social Work. As a student, Mr. Lindbergh served as the student trustee on the Temple University Board of Trustees, and at the time chaired by Fitzeugene Dixon Jr., who also provided guidance. After earning his Bachelor's of Social Work from Temple, Brian received his master's degree in Management of Human Services from Brandeis University and studied social and healthcare policy at the University of Stockholm. Brian felt his skills and interests were best suited for public policy and advocacy. After his master's program, he set his sights on a legislative position on Capitol Hill. He resolved to use the legislative process to affect laws that affect programs and systems to improve the quality of low-income persons, older individuals, and those with special needs. He developed expertise in the fields of aging, housing, legal services, veteran affairs, and long-term care. Mr. Lindbergh advocates for improvements in elder justice, geriatric education, end-of-life care, civic engagement, and special needs. He drafted legislative language that became a part of the Elder Justice Act, Older Americans Act. He has worked on the 1995, 2005, and 2015 White House conferences on aging, and with foundation and key players in the health and aging fields. In 2015, Brian was inducted to Temple University Alumni Gallery of Success and received a Temple University Alumni Association Certificate of Honor in 2012. He is an active member of the college's Board of Visitors. Finally, I'm pleased to introduce John Kirby, Senior Vice President and Chief Operating Officer at Virtua Memorial Hospital. John Kirby is the Senior Vice President and COO of Virtua Memorial Hospital, located in Mount Holly, New Jersey. In this role, Kirby oversees a 334-bed regional medical center that operates the only full-service hospital with maternity care in Burlington County. Virtua Memorial's renowned expert in the advanced surgical and medical care brings world-class treatment to patients across the region. Kirby is an accomplished healthcare leader who started his career as an occupational therapist after graduating from Temple University. He later earned his master's degree in business administration from Holy Family University. His professional career includes 26 years of progressive experience as clinician, director, vice president, COO, and CEO in the nonprofit, for-profit, and academic medicine sectors of healthcare. Kirby is a member of the American College of Healthcare Executives, American Occupational Therapy Association, and actively serves on the Temple University College of Public Health Board of Visitors. Wonderful. And I'd like to thank you all for that who could be here today. I would now like to turn it over to Lavelle, who will be telling us a little bit more on how to build your professional network. And you are on mute, Lavelle.
Wow, what a rookie mistake. Good morning, everybody. I want to say that I consider myself a professional networker. I am a salesperson all of the time. And so I'm either selling myself, I'm selling things or services, and I'm selling other people. And so when I keep that in perspective, there are 8 things that I want to kind of cover that talk about ways that you can engage in networking. And so some of them are kind of rules that I've adopted and things I want you to consider. First, I want to say networking is professional, not personal. So there are some personal aspects to networking, but it's not the same as going out and meeting people. And I always like to use LinkedIn and Facebook, although people do business on Facebook, but they're 2 different platforms, if you will. And so as you network, remember you are taking a professional approach to getting to know people and connecting with people. So one other thing, this is the next thing, networking is not always quid pro quo. That means that every time you help somebody, that doesn't mean that you're looking to be helped in exchange. However, I do want to caution you to be aware of what I call the economy of networking. So, every time you're helping somebody, you're making a deposit. Every time they're helping you, you're making a withdrawal. And so be careful about the networking, the people in your network who are one way. One of the things about my network, I have a very large network. I am always available to help people in my network. And I expect the people in my network to do their best to be available to help the other people in my network. So sometimes when I'm networking or when I'm engaged in networking, I'm not actually the person who's getting the service or getting the information. Sometimes I'm getting people and I'm just having the 2 of them shake hands, make sure it's good, and keep on moving. I'm always actively networking. Having said that, develop your circles of network. This is very important. When I was in grad school, in grad school, there are a ton of group projects. And I was in the health administration program, and it was a lockstep program. But after a while, you got to know those people who you wanted to be on projects with. And so you still worked with other students, but you knew your go-to people. And one of the things that I do is I cultivate a circle of networks. Kind of think of it as a series of concentric circles. And the people in my inner circle of networking, I'm always going to go above and beyond. I'm going to protect that networking circle no matter what. And those are the people who can call on me for extraordinary needs in the business venue. The next thing, this is most important. This is the most important thing. If you don't listen to anything else I say, listen to this. The key to networking is making yourself useful. That's the key right there. You have to be useful in some way in order to continue to nurture and developing a networking kind of paradigm. So, you might think that you're not really useful. What I'm doing in my career, whatever the case. But there are expertise, there are things that you should develop. And the last thing I'm going to do is going to tell you some of those ways that you can develop that. But remember, always look to make yourself useful, which means you're always looking to grow. And this is the next thing. Always be willing to both teach and learn. That right there is kind of what I use as a mechanism to understand if I'm being useful to my network. Am I teaching people? Am I learning from people? That's very, very key. And as you continue to go in that direction, what will happen is your usefulness will continue to grow. Here's the second most important thing I can tell you around networking. Network in all directions. So we're used to thinking about networking up, looking for somebody that's going to mentor and develop us. But at the same time, you have to network with your peers, and you have to network, and I don't want to be negative in this, but you have to network down. So if you're in the middle management position, you have to network in both directions. You never know where people are going to end up and ways that your network can grow and continue to be developed. So that's very, very important. Teach and learn, network in all directions. Now, these are 2 secret bullets right here, 2 secrets. First, always, you're going to have a job, you're going to be doing things, but be available for special projects. Be that person that volunteers to go outside of the realm of your normal activity. That's how you're going to meet people that you don't normally interact with. That's how you're going to be able to develop networks, expand networks, and again, prove your ability to be useful. That's very, very important. Some of us, we don't end up in positions where we can necessarily volunteer for projects, get involved with cross-team projects, cross-departmental projects. And this is the last piece I'm going to tell you, the last secret: volunteer. Volunteer. And sometimes when you volunteer, you don't have a professional thing to offer. Sometimes it's lifting and moving boxes. But in that volunteering aspect, always be willing to engage the people around you, be willing to kind of communicate with people, understand what they do, always ask questions. This is my last thing. You know, in today's technology age, you know, we do a lot of exchanging of information, but don't discount the collecting of business cards. And so when I collect a business card and I ask people about what they're doing, you know, if I'm out and about, I'm going to meet, in a typical day, I can meet 30 different people. I always take the time when I'm away from them, write what they told me about what they did and the things that I thought was important on the back of that business card. So when I put it in my electronic tool, I can put that information in there and I can recall. And not just for this conference, this morning, I reached out. I'm involved, and crazy as this seems, I'm involved in 3 startup businesses and a major ongoing concern down in Georgia. And I reached out to 5 people in my network and set up meetings all for next week because they have the expertise that I need to kind of explore. And I'm very proud of the fact that when I reach out to somebody, when I ping them once and say, "Hey, Joe, I need a little help. Can I talk to you?" Joe responds immediately and says, "Yes," and we're syncing our schedules. But at the same time, I'm doing the exact same thing. When people are reaching out to me, even if I don't have time, I'll make the time, even if it's a quick 5-minute conversation. And so that's very, very important in the process. Samantha?
Thank you, Lavelle. I know I saw some of our students are scribbling down some notes, trying to keep up with all of everything you've said today, which is just so powerful. A lot of which, you know, we learn things as we're pursuing education and even in our professional field, but you're really speaking to very important skills that I don't think are very obvious. So I really want to thank you for sharing your insight with our students. So now that we're talking a little bit more about how to build your professional network, a part of the building your professional network might involve seeking mentorship. And now I'd like to turn it over to Brian Lindbergh, who will talk a little bit more about identifying and approaching a mentor.
Thank you. Good morning, everybody. It's a pleasure and honor to be a part of this symposium. I want to thank Dean Simonoff and Natasha, but particularly Samantha for all the work and leadership she's been doing on this program and for the mentoring program, which I've been very involved with a couple of my colleagues. I see Marvin Nichols is on the in the session here today too, who has been really a leader in this area. My job today is to provide some ideas for you on what a mentor could be, how to identify and approach a potential mentor, and say a bit about, at the end, our mentor program going forward at Temple. So let me start by saying that it's really up to you and your mentor to define mentorship and get the most out of this relationship. I'm thinking of it more as an art form more than a science. And this art will hopefully evolve and mature during the process of mentorship. Both the mentor and the mentee have important contributions to the process, and I'll mention some of those. Excuse me. To mentor effectively, mentors need to gain an understanding of their mentees' needs and develop appropriate strategies to nurture their career or whatever part of aspect of their work that you're seeking advice on, as well as their personal development. Mentees, on the other hand, need to be open about their needs and participate fully. This is not a, oh geez, I've got a call with my mentor today. It's a process you go through, you need to think about what you really want from that relationship. Mentors may be considered role models and work to help mentees achieve their goals in becoming an effective public health, healthcare, or social justice professional. So these folks, at least in my experience, have been critical in my career development and moving forward, and also in helping me understand my strengths and weaknesses. Mentorship roles vary in what they can provide to students. This can include teaching, coaching, general support, providing a place to go that you trust. Candid dialogue can be very helpful. Connections, obviously, that lead to career development. It's where you can go for some open-mindedness and some real honest discussions, and also help you feel empowered. It can be a role, the mentor can provide advice on education or potential internship options that are available in their specialty or their issue areas. In addition, mentors help mentees flourish in the challenging environment of academics and the work environments by offering insights from their own experiences. At least that's what I think of as the best I can provide as a mentor is 35 years of professional life in Washington, D.C. and policymaking. As I talk to a mentee, a colleague, I can share with them those insights that I've accumulated over that time. I think this can help provide confidence to you if you're a mentee, that others have gone through a similar process in their careers. We've faced similar challenges. We may have some ideas of, if there's a fork in the road, if we took the right way or the wrong way, we might be able to share that with you. Mentors can also often provide emotional and moral support as they work with their mentees to build their personal and professional abilities. So as one considers which mentor may be right for you, there are some basic questions you may want to think about. Do I look up to this person? And is there something he or she has to offer me? A particular experience that you see on their resume, a certain knowledge base? Do they have connections in an area that you're thinking about pursuing? Am I able to work well with this person? Do our initial interactions seem comfortable? Are our fields closely enough aligned? You could have a great mentor in engineering, but if that isn't the route you're headed in, you may still benefit from them, but maybe you want to make sure that your fields, your interests are aligned closely enough. Do I trust that this person has the skills and interests to help guide me with my professional goals? And does this person seem comfortable and happy in their own career? I'm not saying that the person has to love their job to be a good mentor, but more than likely someone who has found the right niche for themselves and their career may have some good notions about how you might guide yourself through this early part of your career. Now, it is important to say that this is a relationship that will evolve and hopefully strengthen, and first impressions aren't always accurate. So don't give up if the initial meeting or the selection process isn't quite perfect, unless there's a clear sign that you're just not on the same wavelength or it won't work out. Give the process a chance, because just like any relationship, sometimes it's not a home run right away. It takes a little work and getting to know each other. Once you've thought through your choice, though, you're ready to ask someone to be your mentor. Here's how to do it through email or a message on LinkedIn or OwlNet, which I'll mention a little bit. Introduce yourself and ask for an initial conversation. You should probably send your potential mentor a message introducing yourself, explaining why you're interested in talking to them. Ask them for he or she for a 15 to 30 minute Zoom meeting or a phone call. If I think Zoom is better if you can do it, or a phone call, so you can start to develop this relationship. We can provide some more feedback on your approach, but here's kind of a sample, if you will, of how you might approach your mentor in an email. You know, dear Dr. So-and-so, or dear Susan, or whomever, my name is Brian Lindbergh, and I'm a senior in the social work program at Temple. I'm moving forward in this field, and I have a great respect for your work and what you've done, particularly in creating X, Y, and Z, whatever, you know, makes sense in their background. I have recently completed an internship in this area, and I'm hoping to learn more from your work. If you're open, I'd like to hear about your career story and ask some questions. I'm wondering if you have some time for me in the future, and obviously just, you know, offer Zoom if you can, or a call, and ask if they could provide some times that might work. Here are the key areas I think you need to consider. Clearly describe the guidance you're seeking, what we call down here in Washington, what's the ask? You know, you go into a meeting with someone on the Hill and then you say, and here's what we want you to do, you know, introduce this bill, or sign this letter, or write to the president about this, whatever it happens to be. This is where that preliminary brainstorming on your part will help to articulate just what you have in mind. So you got to think about this. What is it they're going to give you? Describe what advice and guidance you're seeking, and for what purpose. Are you ready for the work world? Are you thinking about graduate school and are not sure what area of study or focus? What is it that they could help you think through? Are you interested in learning about their particular job? That could be a way to start and focus on too. Think about exactly what you would like to learn and articulate upfront, and then write down your questions so you're ready. Confirm your willingness, I think, is important to do the necessary work and follow through. So you got to make it clear to the mentor that you're ready to commit some time, energy, and effort, that you're actually going to use his or her counsel in a productive way. Acknowledge, I think, that their time is valuable. Most of these people, if you want them as a mentor, they're going to be highly successful in their careers and going to be very busy. So you want to make sure that you're acknowledging the reality that you want to fit into their schedule as best you can. Once you've identified a mentor, you'll want to work together to establish a relationship. As I said before, hopefully this will be mutually beneficial, and the relationship will grow. It's important to communicate clearly from the very beginning about roles and responsibilities, the timing that you're going to make yourself available, and obviously you need to be flexible. People have other lives and things can change and such, but you do want to commit to the full range of the mentorship. You know, there will be Temple's program. We have several specific meetings that have to take place. There's some broad meetings where people are introduced, and then there's your individual meetings with the mentor. So all of that, you want to get commitment. These relationships move and develop in their own pace too. So you may end up adding meetings or changing your dialogue a little during the process. That's fine. But you work with the mentor to achieve reciprocal outcomes such as personal growth and interconnectedness and all the things that you outlined at the beginning. If the relationship works out to be an effective match, then this can end up being a long-lasting relationship, potentially beyond what you'd consider mentorship. you may become colleagues, you may become friends, but that's always a potential. Now, if you're looking for a Temple alum mentor, we have something called the OWL Network that can help. OWL Network is an online platform where Temple University alumni community can easily connect with one another and current students, whether you need advice, knowledge about a job, et cetera. This is a great place to go. And we suggest that you join the OWL Network. And there is a place, basically, you go to owlnetwork.temple.edu and you will find it. And Samantha will help you find it if you have trouble finding it. Well, I hope this gives you a flavor for what mentoring and the process can be about and some ideas about it. We're pleased to note that in the fall of 2021, that's this year, the College of Public Health will be fully launching the alumni student mentoring program. Juniors, seniors, and recent alums will have the chance to connect with alumni and friends of Temple to support their professional development through this very structured program. Samantha has spent, I would say, hundreds of hours, maybe thousands, I can't tell, to put this together. It's a fabulous opportunity. So please look out for more information later in the year on how to access this. And thank you again for joining us today. And thank you, Temple, for including me in the program.
Thank you, Brian. And this has just been such a helpful session so far, and we're so thrilled to have everyone as a part of this. I did want to just say a quick thank you to Brian, as well as Marvin Nichols, who I see is on here today. And I don't think our third member of the Professional Development Committee is here, Jasmine Edwards. They've been instrumental in informing this really helpful mentoring program for students and alumni that we're piloting now, and we'll be excited to be in touch with you later this year with details on how you can join the full program.
I see Marvin is on campus today. Very nice.
It's springtime. Springtime at Temple. Perfect. Well, this is great. We still have plenty of time. John, I just wanted to make sure you had enough time too, because there's just so many good things in this session. So without further ado, John, I will let you go ahead and talk about, now that we've learned about professional networks, about mentors and how to seek a mentor. Really, we're interested in learning how to nurture that those professional relationships that we're learning to build. So thank you.
All right, sure. And thank you, Samantha, for inviting me to participate. I've had folks help me out in my career, and I love the opportunity to give back and give advice. I'll probably take 6 or 7 minutes, and then really, hopefully we can use the rest of the time for questions from the attendees. But nurturing professional relationships is really important, and I agree with both Lavelle and Brian on the comments that they've made, especially Lavelle. I know I've had a few people in my network who were named after that street in Philly, the one way, like you said, right? So it's really important not to be that one-way person. But let me just say a few things, in networking and in mentoring. Look in and outside of your organization. Look into your family and friend circles too. It's really important. I tell people, I have 3 kids, and one's finally starting college next year. He's going to pursue nursing, and I tell people, I say, I use LinkedIn, and people tap into my network all the time. And I've told my kids and their friends, I said, you're born into my network. So, try to figure that out and use it as you move forward. So don't be afraid to look to your family and friends. I've provided some guidance and recommendations to some of my kids' friends who, are in my house a lot, and I feel like, I should be claiming them on my taxes because they eat so much of my pizza and snacks. But, the opportunity to give them some advice, is something rewarding for me, because I didn't have that when I was growing up in Philly in a row home, like so many people, probably on this call were. So look both in and out. Organizations, let me just say, organizations are small communities, it's like that small town, who's dating who doesn't like who, right? Just be aware of that. When you're in the professional environment, it's great to have friends. If you're in a small organization versus a large organization, politics occur, and it's okay. You can be aware and use, depending on the organization, use and identify people in that organization to help you develop, grow, and mentor. Once you do have that relationship, I think it's important, as Brian mentioned in reaching out, don't be afraid if someone doesn't get back to you right away. I've had bosses who want to see how long kind of folks it's important to somebody, and they'll sometimes wait to see if they get a second ping, or if someone drops off a proposal, they'll put it on a pile and see if they come back to check on it. So just know that some of us who have a lot of email in a day, will sometimes miss things, right? But once you do have that relationship with mentors, colleagues, professionals, LinkedIn, clearly that's a great opportunity. You can find me on LinkedIn. I have over 2,000 folks that are linked to me. I'm pretty free in general with people who want to link to me. And I can tell you that in my career, that's where all recruitment occurs now. I'm constantly being hit up by recruiters to, tap into my network, and, some of them want, me to consider a move or a position that they have. But a lot of them just want to know if I know somebody within my network that they could potentially refer. So once you're, developing these collegial relationships, and you maybe have a formal mentor or not, I think it's good to, as Brian said, spend some time, have a Zoom call, a FaceTime call, and get to know them, but know what you're looking for out of them, right? Have some goals, right? I've had situations where, working in an organization, a newly minted employee decides, hey, that would be cool to be a CEO or a COO someday. And then, they'll sit down with me, and, and I see their eyes glaze over when they hear my story and the path that it took for me to get there. So you're not going to go from frontline to running the organization overnight. I'm sure it exists out there, but, it's probably less common. So, I think that's a great thing when you're talking to mentors and professional colleagues, is ask them to tell you their story. And I think that really will open up your eyes and your mind when you hear about how people did it. A lot of it is just through perseverance. I think Lavelle, everything you said, I concur with, and I think you touched on that. And then drop them a note once in a while. I'll say what, I read before, a written note is worth 10 emails, right? And so emails are great. And, I appreciate it. Know the timing of emails, right? Today's a great day for me to get through emails. I make my schedule light on Fridays, right? I like to get out of the office a little earlier on a Friday, right? So you're in a better mood. It's also a tip for interviewing. If you can gear yourself towards a Friday interview, it's much better than a Monday interview. It's just the general way that we kind of wake up and go through the week. But Fridays are a good day to drop a call, send an email. But remember the value of a letter once in a while. And I was told when I met with people and asked them for advice, hey, drop me a note once in a while to let me know how you're doing. And so I'm passing, a tip along that others passed to me, and I did that. It takes work, and so you're going to have to make sure you schedule some time to do it. To say, hey, today I'm going to network with somebody today. That's my goal. Or this week I'm going to send 2 emails, so keep it simple. and I think you'll do good. As far as and I've heard Lavelle talk about this, and I agree. When you're in an organization and you're scoping out the organization, and you're an entry level, and you maybe want to get to a supervisor, director, manager, get to know who those folks are above. Volunteer, for committees. Be a great employee to your boss, right? If your boss, at budget time, it's a busy time. If you're somebody that's, good with Excel, or, and you go to them and say, hey, look, I'd be happy to help you out. I want to learn. So when you're going through your budgets, if it's possible, let me, I can help out, and I can keep track of things for you, or, help you with presentations and things like that. I'm sure they would really benefit it. And then it gives you the opportunity to kind of highlight your style, yourself, your personality, and what your abilities are. Small steps, I think, are important. Don't have a fear to try something new. I think you'll look at a lot of us and see that in our career. If you link to us, you'll see that we've been with different organizations in different roles, and some of it's serendipitous, some of it's planned. And I guess in closing, I think doing your, I guess I'll just reinforce doing your research. I'm going to share one thing in closing, and it's a real story. And it's, I'm actually recently asked to oversee another hospital. So I'm running 2 hospitals now in Burlington County. And, there's a gentleman that works in one of the departments, and he seemed like a nice guy. And we have a safety huddle every day where I pull my directors together and just kind of get a quick 30-second report out from everybody to see how things are going in the hospital yesterday and today. And, it's a way for me to kind of keep a pulse on safety and operations. And then one day I walked by his office and he wasn't there. And, so I asked, I said, what happened to, we'll call him Joe. It's not his real name, but we'll call him Joe. And they said, oh, he quit. And it shocked me because, I dove into it a little bit more, and I said, hey, what happened? And they said, well, his boss made some changes and he didn't like them. And so he just quit, and hey, if he doesn't need to work and has a lot of money, that's great. He's got a strong FU account. My wife calls that it's the for us account, right? That's great. And I can't wait to be able to do that myself someday. But, having a job, it's always easier to get a job when you have a job. So there's going to be times where bosses are going to make decisions you might not agree with. Give it a chance. Sometimes you'll see it. Sometimes they're just not a great communicator. And then you'll understand it later. Something will finally click. And then there's times people are just going to come in. I've had them. I've had bad bosses who just want to change everything. And when that occurs, that's usually when you say, all right, well, I'm going to take my skills, my network, my mentors, and figure out where my next, path on this journey is going to be. And, if that gentleman would have reached out, that's the advice I would have given him, is that, I know growing up, I grew up that way in Philly, tell your, boss what to do and that kind of stuff. But that doesn't always work out for you on the long term when you're trying to build a career. So hopefully you appreciated some of my humor and some of those tidbits, and I appreciate the opportunity to share, and happy to answer any questions you may have.
Hey, Samantha, can I jump back in? Because
Absolutely.
based on, well, there are 2 things I want to tell people. One, when you think about mentoring, make sure you are open to what I'm going to call situational mentoring, not necessarily long-term mentoring. I was doing some nonprofit work, and a guy named Jeremiah White is very big in the city. He was my boss, and I needed to learn more about community development. So he said he could do it, but instead he sent me to this other woman. Her name was Mary Kennedy, and she was superb at it. And the only thing she mentored me around was community development. And that was situational, and it was very, very powerful. In a similar situation, I want to say, when I did work, I built health plans in Georgia and South Carolina, and I'd go down there, and I was who I am, and I'm straight to business, moving things forward. And I had one of the people who worked for me. She was actually there was a director between her and I, but we had gone on a couple of meetings, and she took the time when we were walking out the car one day and said, can I help you? Will you let me help you? You're moving too fast. She said, that's not how they work down here. We got to talk about this, that, and the other thing before we get to business. And I'd like to help you with that. And she agreed to sit next to me and kick me under the table when I started going too fast. So, and that was the way she mentored me. So mentoring can come from multiple directions, and it was very, very useful in both of those situations. I have long-term mentors and I have short-term mentors, and both are vital.
Such a great point, Lavelle. Thank you. So I had a couple of questions come in through the chat, and pretty soon we'll be taking a break before our keynote. So I think we can get through a couple of these, which is great. This is a question for Brian. Let's say someone has a mentor, what wisdom or advice would you impart onto someone who is unsure of their career path and next step, and has a mentor and is seeking additional support?
Okay, if I understand the question correctly, I think it in some ways it relates to Lavelle's point, and that is one can have multiple mentors. If you may have a great mentor for certain aspects of your life, maybe academics, you've had someone who has really helped you through choosing your classwork, choosing your graduate program, whatever. That person might not be the best mentor for your next stage of your career. So again, I think going back to some of the things we've talked about during this session is that think through what is it you specifically would like to secure from a mentor, an additional mentor, or, I mean, obviously your current mentor might even have others that could help you if you could feel comfortable talking to her or him about that. But think about very specifically what you need, and then if you really want a job at CMS, the Centers for Medicare and Medicaid Services, you may need a mentor who has worked in the federal government. So that's the kind of approach I would take if I understood the question.
Yeah, I think that's very helpful. Thank you, Brian. We have one more question. Here's one for Lavelle. Is long-term mentorship versus short-term mentorship something that is established at the beginning of the relationship, or does this tend to just naturally play out?
I would go, let me say, I think it goes back to what Brian said in your introduction, when you clearly outline what it is that you need and what you expect from it. And I would not necessarily think about long-term mentorship. I would be very specific and see what develops from there. I have mentors that I've had, 15 years, and they still call me, but the level of interaction that they need may be reduced. And I have got one woman, she is the vice president of organization, and she's quick to say, hey, you're supposed to be my mentor. Okay, let me help.
Excellent. That's so helpful. And then one more question for John. And this question would be, do you have any tips for meaningful small talk if you meet a potential mentor at a conference or symposium and only have a brief period of time to connect with them?
Yeah, that's a great question. So I've done that. Do your homework, right? Hopefully when I used to mentor, when I used to network a lot and I was going to a industry event, the American College of Healthcare Executives is one of those. So if you want to kind of get in to know what the insurance folks and the hospital folks in the Philly market, they have a great meeting downtown once a year that's pretty much open to, I think members or non-members.
Okay, we're just about at the top of the hour. Amani is a wonderful student, and she was like the first to turn on her camera. So she did it again, and she's going to lead the way for our other participants today. So again, if we can, those of you that are courageous enough to turn on your videos, thank you for letting us into your home or apartments or wherever you are on campus. It's really great to have you all here today. And it's especially wonderful to have such a distinguished group of panelists to help lead this discussion around innovation in public health and healthcare. And we really did seek out the leaders for this, and they were very gracious with their time. And so I'd like to welcome everyone and to this particular session. During this session, our distinguished panel of industry leaders will discuss the societal impact of a career in public health, entrepreneurship and innovation in healthcare. And they will also share important trends with regards to the future of technology in healthcare and public health and future opportunities for new innovations. To help lead the discussion, joining us today, we have an alumna, Hope Watson. Hope Watson is a proud alumna and Temple 30 Under 30 honoree. She's presently a data scientist at Current Health. She's worked to develop machine learning models in areas of health in the healthcare space, ranging from preclinical research and development in pharmaceutical pipelines at Alexion Pharmaceuticals to healthcare delivery systems involving payer analysis at Haven Healthcare. Hope focuses on the area of AI interpretability and liaising between clinical expertise and statistical analysis. Next, we have with us Dr. Ravi Rajan. Dr. Rajan is a member of the college's Board of Visitors. He's a healthcare entrepreneur and board-certified urologist who has been practicing innovative and patient-centered urology in Bucks County since 2000. Dr. Rajan has also been named as one of Philadelphia Magazine's top docs. Next, we have Tom Gordon. Tom is also a member of the college's Board of Visitors. He is presently the Senior Vice President and Chief Information Officer for Virtua Health System. It's one of New Jersey's largest health systems. He has more than 25 years of information technology experience in healthcare and banking and extensive leadership in healthcare as well. Mr. Gordon is also the 2019 recipient of Philadelphia's CIO Orby Award, something you can Google if you don't know what it is, and Tom can also share a little bit. Last but certainly not least, we're absolutely thrilled to have Dr. Nicole Quick join us today. Dr. Quick is a clinical informatics physician at Epic Systems. She brings over a decade of diverse healthcare and public health experience to Epic's work to improve population health and preventative care. She is part of the Epic Health Research Network team, focusing on rapid sharing of new medical knowledge by bringing observational data directly to physicians and researchers. That's so important. She is trained in preventative medicine, public health, and addiction medicine, and has led several large-scale leadership positions in government services. I want to thank each of you for being with us this morning, and we can certainly give you each a minute to share anything that you want to add before we get move to questions. Okay, maybe Dr. Quick, do you have anything that you'd like to share first?
Yeah, and I guess just a thank you for having me. I enjoy very much talking with sort of the next entry into public health, the next workforce. I think public health is a very diverse and exciting field to be in, and I look forward to sharing today some of the insights I've gained and just thanking everyone for choosing public health to go into. It's extraordinarily important and a lot of fun.
Good news there. Okay, Tom?
Yeah, I would echo what Dr. Quick said. I mean, there was already a ton of innovation happening in the medical and healthcare space, and you know, if there's anything good that came out of the pandemic, it's that those things really took a giant leap forward, and you know, nobody's looking back. So you know, I think the future is bright, and there's a ton of opportunity in IT, informatics, and healthcare in general.
Thank you, Tom. Ravi, did you have anything you wanted to add?
Yeah, I echo the sentiments. Public health is in the front pages now, and I think it's a great time to be in public health. And whether it is taking care of patients or setting policy, it can be for governments, it can be for industry. Public health is needed more now than ever, and I'm glad we have such a nice flow in the college to help.
Thank you so much, Ravi. Hope, you're the, I guess, most recent or close to what would be those coming out and into the out of college and moving into the workforce. Is there anything specifically you want to share before we move to some of the questions we prepared?
A little bit of echoing what other people said, but I think the fact that you finally have health coming into the forefront of the conversation, usually it's economy, media, those kinds of things. The job growth, especially in epidemiology, I think is going to surge. So this is really interesting. And although we're talking about sort of societal, entrepreneur, and just like impact as different kinds of things, they're obviously really tied together, as pretty much everything's technology focused at this point. So that's all.
Excellent. Hope, actually, we're going to start with you. Can you start the conversation by talking about a little bit more about what drove you in particular to pursue a career in public health?
Yeah, so I think for me, it comes down to the why. I've gotten sort of a skill set now in healthcare, but also really heavy in technology. And so I could have used these technology skills that I developed to quite literally sell people more dog toys or furniture, or essentially create algorithms to keep them on social media for longer. That just doesn't really speak to me or the kinds of things I want to be working on. And although it may sound like a little self-righteous, it's actually kind of selfish, because I think if that we had healthier, less stressed out people, that on average, our interactions with each other would be a lot better. So it's kind of this idea that, like, you know, the foundation of every good society comes with them being healthier. And this takes a lot of different practitioners and people who are interested in the tech side of things. I will say when I entered college, which was not that long ago, it was 2013, feels like a long time ago now. I feel old already, but I wanted to be an orthopedic surgeon because I had had injuries and knee surgeries and different things. And I did the whole pre-med thing. And then I picked up a public health minor, actually, and I got really interested in biostatistics and essentially being able to affect thousands of people with just these models and different sort of mathematical things that I can do. And so this was kind of the pivot point where I decided I didn't want to be an individual physician. I very much understand the necessity for it, but I was kind of okay looking to do something different. So I said, okay, I'll take a year to do a master's degree, which I did over in England at Cambridge, and kind of see what I wanted from there. So I think for me, I just realized I wasn't as committed to the idea of med school at the time. And this biostatistics field and epidemiology, I kind of kept gravitating toward that. And that's kind of, you know, where I am. And I think when I think about those two fields in particular, I think the future of it comes down to a lot of genetics. It comes down to a lot of how can we get essentially the hospital systems and EMRs to talk to each other, so the electronic medical record systems. So those are the kinds of things that, it was a little bit of being cognizant of where I wanted to go, and then it was a little bit of just, your path throughout college as you change a lot in those 4 years, and maybe even change majors like I did. But that's kind of, how I decided to pursue it, is that health is a really good space to sort of give you that impact, that feel-good impact as to why you're doing what you're doing. I just didn't think I was going to get that in other fields. You're on mute.
Thank you. This is a great segue to talk to Dr. Quick, actually. Can you talk a little bit about, I would imagine that most that are participating in this session know what EPIC is, but can you talk a little bit about EPIC, how EPIC's actually been in the forefront and sort of driving the innovation with regards to the patient at the center and the communication, with the electronic medical record system, and also specifically how health data can be used to drive outcomes at a population level?
Yeah, absolutely. So very important information sharing, being able to access timely data in a meaningful way, that existed pre-COVID. COVID just highlighted that even more. Being able to have timely data on what we're seeing as far as outbreaks and treatment outcomes is critical in response to the pandemic. One of the greatest opportunities, I'd say, going forward for public health, meaningful public health, is utilizing these, the data that we have across the country on patients, on surveillance, on public health outbreaks, early detection, and so forth. We have an opportunity now to sort of bolster all of the public health IT infrastructure, both public and private partnerships, and really improve how we look at data so that we can, in a timely manner, not only detect potential future pandemics, respond to them, see how treatments are working, and so forth. So I think that is a very important area of further development that can happen that COVID sort of highlighted. I also think it's important to point out one thing that is maybe a silver lining of the pandemic is people, and this is across the board, public and private, being willing to share information in a way that maybe didn't happen pre-COVID. So that's something that we should celebrate. We have done really well as a society in sharing information, looking at how quickly we developed vaccines and how people were willing to share sort of medical and I'd say technological insights during COVID is sort of unique. And I think that's something that we should all try to continue going forward.
Thank you so much, Dr. Quick. Would you also share any advice? Do you have any advice for Temple seniors and young alumni who are hoping to really step into the intersection of healthcare and information technology? Like they have an interest and they've got their public health degree, but what's next? What would you recommend?
Sure, I'll give a little background on kind of to echo some of what Hope said. Public health is incredibly diverse, and how individuals end up in public health is a very, I'd say, sometimes winding road, including myself. I started out as an emergency medicine doc and ended up in through a series of events in county level public health, and now at Epic working in clinical informatics and really using observational data to drive population level health outcomes. So what I want to reiterate is somewhat kind of what Hope touched on. Take opportunities as they come to you and explore them. Public health is literally, in my mind, anything that affects population level health. And there may be opportunities that are given to you or potential projects that you may think, well, was this something I was ever interested in? I don't know. Where it will lead, you never know. And so one thing I like to tell everybody entering public health is be very open to potential opportunities. I think the intersection between public health and technology is going to become more and more important. I do agree with what other speakers have said. Sort of, in my mind, I look at it this way. Public health and population level health, you have a set amount of resources no matter what. You're trying to affect the population of the entire country in a positive way. So technology can help us either take care delivery outside of the traditional things that we used to think of. You know, telehealth is a great example of that in the pandemic. We really looked to streamline ways to reach more populations, or in a better way, or in a more cost-effective way. Innovation is essential in targeting our limited resources to make the best outcome. So what is my advice as far as the, how to break into that? Be very, I say, open to opportunities and where they may take you. And public health is incredibly diverse, and there is a lot that you can do out there, whether you want to focus in on something very specific like biostatistics, epidemiology, all the way to being involved with sort of more of the health promotion. There's just a lot of opportunity out there, and you just need to be open to where it may take you.
Great advice, Dr. Quick. Thank you so much. This is a great segue to Tom. Tom, in your daily work specifically, how do you see technology changing the landscape of healthcare and public health? And you are like boots on the ground. You're in it day in and day out. Can you speak a little bit about that?
Absolutely. Thanks, Natasha. That's a fantastic question. As we're hearing, right, telehealth, remote care, remote work in general, this new term that healthcare is talking about, the digital front door, redesigning primary care to incorporate all those things, the surveillance pieces that go along with that, adding in tools like machine learning and artificial intelligence to help where appropriate, it are just dramatically changing the conversations that we have every day, and they're, you know, on a high trajectory. It's no longer like a year-long conversation. Things are happening like that. And so I wanted to talk about, you know, one of them specifically, you know, as healthcare services have, you know, begun to resume during and after COVID-19, the ways patients now interact with their providers and their care institutions, their clinics, et cetera, you know, it's changed dramatically, and we don't see that ever changing back. And so, for example, you know, instead of, you know, people automatically heading to their local clinic or local emergency department for something that would, you know, be less acute, something minor, right? Patients aren't doing that. They're looking for those abilities to have that encounter happen via telehealth, or potentially even you know, something, a screening tool that could be filled out, and where somebody can assess and a determination can be made on what are the next steps, you know, what are the preventative care steps. I think Hope was talking about preventative care. I mean, that's becoming a big piece of it. We've seen, and you know, I was just looking at a research document that came out from Epic. ED volume across the entire country is down something like 36%. That's exactly where we are. And so we are seeing about 36% less patients come to the emergency department. However, most of those cases that are coming are higher acute than what they used to be. So what we've seen is, you know, people that really need to come to the emergency room are still coming, but those other less acute things are either not coming, or they're having something done through telemedicine or whatnot. So it's kind of changing you know, how we're going to have to look at things. As a result of that, most, if not all, healthcare organizations, you know, that can't afford to ignore the technology around this thing we call the digital front door. And there's a bunch of capabilities there, right? And it's telemedicine. So it's, you know, video, maybe multiple video platforms. It's mobile applications, it's web portals, and all this has to be connected with your EMRs, you know, like Epic. And so Epic's a good example of trying, you know, they are helping to try and build that infrastructure to allow all those different pieces to speak, because at the end of the day, it still has to be easy. It has to be easy for the patient. It has to be easy for the clinician. We're also seeing a big transition to home monitoring, this whole hospital at home philosophy of where, you know, it exists today, right? We all have, you know, I shouldn't say we all, but the majority of people have good enough bandwidth at home through Comcast or Xfinity or some other service. And, you know, blood pressure cuffs, scales, even surveillance type tools are starting to be deployed into the home. And so we think that's really going to continue. And the pandemic has really helped push some of that forward, because people now don't always want to go to the hospital. So it's a challenge that we have to now meet and say, we'll meet patients where they want to be met. As an IT guy, I am a big believer in KISS strategies, keep it simple. And so I spend a lot of my time trying to make sure that the strategies that we put together around digital are purpose-built and simple to use. Because at the end of the day, if they're not, then, you know, we're gonna end up chasing our tails. So at the end of the day, I think the biggest thing that's changed in my daily work process from an IT and informatics perspective is, you know, again, if anything, that pandemic has moved the needle and the conversations to meet those needs and meet those more modern approaches to healthcare needs. And those conversations that may have taken, you know, a year or so in the past are now happening in a week. Decisions are getting made, and things are happening to meet patients where they want to be met.
Thanks so much, Tom. You know, for new alumni or recent grads that are interested in this area, they've got their maybe public health degree, or maybe they're a clinician, but they're really interested in the data side of health. What technical skills would you recommend that they work to develop for success?
Sure. So that's a great question too. And so I'm gonna tackle that two ways, Natasha. I'm gonna say two critical skills that I think are really important for technical, but really anything we need to do is communication and presentation skills. And communication skills in IT are paramount. You have to really be able to communicate well, and you have to be able to listen well. There's an old IT saying that goes something like, I gave you what you asked for, even though it's not what you wanted, which means there's a breakdown in that communication. And so that can have dire consequences in health IT and healthcare if the two groups aren't able to share their ideas and communicate well. Then the finished product might not come out right. It could be wrong data. It could be a slow process. It could be a breakdown. So communication skills are paramount. And I believe in the skill with communication of the 5 Bs. Someone had taught me many years ago, and I never forget it. The 5 Bs being be brief, baby, be brief. Meaning, you have to be able to make sure you can make your point and then sell it, which then takes me to presentation skills. So effectively presenting your idea, even in the IT world, right? We have to come up with innovative ideas, solutions to problems. So you have to have that technical skill, but just as important, you have to have the presentation skill. So you want to be able to effectively present your idea, and stories work really well. So present it in some kind of business story, success story that goes along with it. You still want to grab people's attention. And even in this world that we're living in now, right? So a lot of times when you would have people around a conference room table or, in a meeting, the communication was a little bit easier at times. Now we have Zoom meetings, we have Teams meetings, we have WebExes. And so you really have to be able to make sure you're able to tell your story and capture that audience's attention, because it's easy for people to lose attention. So I think those two skills are really critical. On the technical side, that analytical ability to look at data, understand what the data is telling you, and then how that story comes together is key. There are so many tools around machine learning, artificial intelligence, big data. There's probably folks on this call that are really interested in research. And over the years, the research tools have gotten really, really good because of big data. You still have to understand what you're trying to go after, but the tools have really enabled great things to happen there. The EMR vendors, other big data vendors, Microsoft, Amazon's getting into the game. So the ability to pull data together and really analyze it, instead of taking months and months and months, can be a matter of days, hours at times. So really being able to understand and harness those tools. And then lastly, I would tie something into what I call a new skill. This is a first, Natasha. I want to copyright this one, but I call it website manner. And I think it's a critical skill that technology and informaticists folks need to have, but also physicians, nurses, and others, because all of a sudden our encounters via Zoom and Teams meetings and other forms are things that didn't exist before. And so we need to all learn how to have that good technical skill of being able to hold a meeting via these tools. So, you don't want to, I don't know how to share my screen. I don't know how to do this, but you want to be able to understand on the telemedicine side how to conduct that telemedicine visit with a patient, even clinician to clinician pieces. So I think the website manner is going to be a new tool set that we're all going to have to learn, because I don't ever see it fully going back to the way we were before.
Well, we could say they've all heard it here first, Tom. So thanks so much. Website manner, love it. It's thank you for that. I want to transition to Dr. Rajan, because you're a clinician. So before we maybe jump to the intersection of how entrepreneurship can help solve problems, or thinking of yourself as maybe a clinician and entrepreneur. Do you have any, do you want to react to what Tom was talking about in terms of sort of the website manner? You've been using telehealth, I'm sure, in your practice, but do you want to react to that?
Well, I don't go in many WebExes as Tom does. Most of mine are one-on-one with patients. So for patients, it's they have the ceiling fan going and we can't hear them. And a lot of my patients are older, so they don't know how to use telehealth. The connections are easy, but for many patients, how to turn on the microphone, how to turn on their camera is difficult. So as simple as it is, we got to have it simpler for the patients, especially the older ones. And as Tom said, a lot of us have bandwidth, but not everybody. And it's going to impact the poorer communities. As we become more tech savvy, they're the ones who are going to be left behind.
Thanks so much, Ravi. Can you talk a little bit about in what ways you're a clinician, you run a successful practice. In what ways can healthcare and entrepreneurship work together to help solve problems?
I think it's a must for us to move forward. The entrepreneurs are there to solve problems. And we are in a great time where there's a lot of data, and whoever can collect the data, analyze it, and then figure out a way to use it to improve people's lives, especially their health, that's where the entrepreneurs will win. And without money, without funding, the best ideas won't go anywhere. So the entrepreneurs will solve a problem, and public health will improve from it.
Thank you so much. So for those that may be interested, we likely have some participants here that are not sure what direction their career might take them, but they might have a great business mindset and consider themselves entrepreneurial. What advice would you give to those that aspire to be entrepreneurs in the healthcare space?
It's going to sound counterintuitive, but I'll say fail and fail often. Get out of your comfort zone, do things that you think will work, but you will learn. Every time you fail, you will learn. People who don't fail aren't trying. Go out and don't be worried about failing. It will make you better.
Thank you so much, Dr. Rajan. I want the next question I'd like to present to Hope to answer first. What advice would you give to CPH or public health seniors and young alumni who are exploring a career in public health specifically?
Yeah, so a couple things, public health is not just the public sector. I think most jobs are in the private sector. This is the biotech companies, the pharmaceutical companies that I'm sure lots of recent college grads are afraid to kind of go into pharma because of such the bad reputation that it has. And the reality, there's some realities to that, but there's also a lot of opportunity to really embed yourself and learn about these patient populations, whether it's rare disease or something else. One of the other things I just want to quickly touch on is that people are so like data driven, but a lot of the stuff that I work on and the stuff that you've heard about, like connectivity issues, I actually work in remote patient monitoring. And most of those people, why we're not getting their data, we're not getting their heart rates, we're not getting their SpO2, is that their internet's not fast enough and they're not connected properly. And so part of my job, and whenever someone's asking you to do a report or do something data driven, it's sort of asking yourself, like, do I need data science to solve this problem, or can I sort of solve the problem that's in front of me with my job with what I know and what patients and people are telling me? So that's one thing. Jobs are all over the place in the private sector. And then the other thing that I would really encourage is that I think a lot of people are talking about is, like, don't be afraid of quantitative routes. I think that limited me. I was originally afraid to take all the math and other things, like even during my undergrad, and started to do that in my graduate degree. Why is this important? Whenever you're trying to solve a problem, someone's going to ask you to quantify your impact. And so having some sort of like literacy around that. And then the final thing is the technical literacy. There's, you don't have to take computer science to essentially have an opinion about whether the EMR systems are working for like your patients, or you don't need to essentially, like, you don't need to solve problems, technical problems with technical skill sets to point out that technical problems exist. So what do I mean? There's a whole bunch of jobs like a product manager, for instance, is one of the most recent jobs, where essentially you have some sort of baseline understanding of technology, but you're really more about like the business application and making sure the customers, and in telehealth, it's the patient on the other end of the call, is getting their needs met. So, you can leave it to the techies to essentially, like, they can come up with an algorithm to make the noise of the ceiling fan less on a call. You can automatically have the video and audio turned on. So those are things that can be solved, but you need people to actually escalate those issues. And there's literally jobs dedicated to all the technical usability problems that we have with the stuff that we've built. So I think like that was a lot, but yeah, I think for me, I've had some job changes and things that were tumultuous. I had job interviews that I realized they weren't going to be the right fit for my ethics. And those are the kinds of things that I've decided like not to compromise on early. If something feels weird, or I don't like how they might be using data and those kinds of things, I stay away from that. And my logic is I'm way too young to sort of go down the wrong path, that I don't want to find myself working with certain types of people on certain kinds of problems. So I think just like work on what you're passionate about and make sure that the people around you are like good people and like-minded. That's a lot of advice. That's more life advice than anything else, but hope it's helpful.
Oh, thanks so much. We actually talked a lot about values in the last session, and so and how important that alignment was. So it's great to hear you speak of the same thing and elevate the importance of that. My last question before we transition to sort of just general questions from our participants, and we already have a couple in the chat, some interesting ones. This is for all the panelists, and whoever feels most comfortable can certainly answer, but where do you see the greatest opportunities in the next 10 years in healthcare, and where, in healthcare and also in the public health space? I don't think ever imagined that we would see a pandemic. Maybe there are probably some leaders that had the foresight to know that this was on the horizon, but where do you see us going from here?
I'm happy to jump in and talk from a public health standpoint. I think in my mind, one of the greatest opportunities is expanding on the public-private partnerships that we've seen sort of increase during this pandemic. And I think we should all be well prepared for, if not, I mean, certainly COVID is with us for the long haul. So what does this mean going forward? I think we should work as a society to be better prepared and continue to prepare. So there was sort of systematic defunding and underfunding of the public health infrastructure in this country for a long time. And opportunities now is to let that not happen again. And that involves all the things we've been talking about. It's not just the public sector, it's the private sector, and it's innovation. We really have limited resources, and to affect positive population level change, we need to streamline that and do our best and do population level interventions in the most streamlined and cost-effective manner. So I see that as a great challenge as well as a great opportunity. So there is a lot of opportunity for new minds to come into public health and figure out how that happens and how we make that meaningful change going forward.
Anyone else want to speak on that before we move to questions?
I can speak a little bit on that. What I'm most excited about are wearables. When someone comes to see me or other physicians, we see one point in time, and once wearables are, let's say, can gather more data, we'll now have a better window of what is occurring with the patient. A friend of mine who's a urologist in Philadelphia, Greg Dean, has come up with this innovative product where there's a sensor in the diaper. So if a patient is in a nursing home, there's a Bluetooth that goes to a signal, and then the nursing home knows the diaper has to be changed. Family knows the diaper is wet. They know how long it will take for it to change. Small innovations like this will change how we deliver care and hopefully improve care.
Sorry, go ahead. I was just going to say, I'm excited for the non-pharmaceutical interventions, like the wearables that are coming, the health apps. The key thing there, though, is people have to actually want to use it. And I think the usability and the patient experience around that stuff, you can make the most innovative technology, but the barrier is people don't want to use it or it's uncomfortable. And those design aspects are like really what people should focus on as we kind of move toward that technology helping us. That's the only thing. It's amazing, but people have to use it and it has to be integrated into their lives and they have to want to use it and not think about it. Doing things really simple for the customer or the patient is actually really hard from a technical point of view, and solving those kinds of things, just kind of what I'm in the crux of each day.
Yeah, and I would just wrap that. Yeah, I would just wrap it up by saying, you know, I think the hospital home, which encompasses all the wearables and whatnot, I think it's a really great opportunity to meet patients where they are. So I think that the technology pieces are the abilities are just going to grow exponentially over the next 3 to 5 years. So it's really exciting to see what the possibilities from a data side and just a general healthcare perspective. The conversations, and I'll add public health in there, the conversations that are now taking place around disparities in care, that conversation is now elevated to a whole new level. And, there's so much data that shows that those disparities in care, it really do exist. I mean, I'm in Voorhees, New Jersey. I can tell you, just 7 miles away in Camden, it's completely different between the two populations, and the data shows that of life expectancy and some of these basic things. So when you start looking at the data, not only at a problem to solve, but there's a business use case there too. So there's financial impact. There's taking care of the disparity. There's looking at just the having a the difference food can make. And so really that is a tremendous opportunity that healthcare is, and you see it in our area that we're in here now. We're fortunate that many of the healthcare organizations are taking a step into that to try and change that curve. But you see that conversation happening all over the country. And so I think that will also pay off dividends over the years, and that'll affect us all having better care and cheaper care, hopefully, and more efficient care. So I'm really pretty bullish on the path forward around both the technology, but also the fact we're looking at disparities in care the way we are right now.
Excellent, Tom. Thank you so much. So we're going to transition right now to the questions that we have from some of our panelists, and I again encourage the questions from the participants. I encourage all the participants to post your questions in chat. You can also use the reaction feature to essentially raise your hand to ask a question. So we'll read the first one. In the interaction of public health and technology, what do you think about the progress of interoperability in our current healthcare system? How could we as public health workers improve the patient awareness of the technology uses in their healthcare experience?
I'll go talk about the first question first. Interoperability is improving every day. When EHRs first came on the horizon, the government said the EHRs have to speak to the government, but not to each other. As time goes, those are changing. There's still hurdles. Which format are we going to use? The different EHR vendors want to use their format or have their own ideas. So it's not perfect, but it is getting much better. And soon, if someone goes to the ER, hopefully their records will be available no matter which hospital or physician they saw. We should all have it readily available to give the best care and the cheapest care.
Thank you, Ravi. Tom, did you want to weigh in?
Yeah, I would agree 100% with Ravi. I mean, we've seen great improvement from where things were. There's been incentives to do that. There's been regulations, but it's at times gotten so good that the physicians are like, oh my God, I don't even want to see all this information because it's coming in from all over the place. There's another, I think it's a great thing that's happening March, in a couple more days, is the Cures Act, which is requiring all results to be released to patients immediately, and also physician and, well, I'll say clinical notes to also be released immediately. So if you have a patient, those things have to show up. Continued stuff like that is going to drive better interoperability. It's going to drive different conversations, changes in how healthcare, operates and interacts. So, I think it's the technology piece there is really improved. There's still a lot of challenges around the rules and regulations, which at times are very outdated, and outdated when we look at public health. I'm not just saying this because Dr. Quick's on the phone. Epic has a pretty good, look at saying, hey, we're gonna share information, and we're not going to, because we think it's better for public health. But not every single buddy is in that same bucket, and from state to state, rules and regulations are different. So that there are some challenges there, but there's a whole wealth of data that I think, and we're seeing it could really benefit public health around pandemics and different things, as long as we keep patient privacy protected while we're doing that.
Thank you so much. So I had another question that came through individually from the chat. For the panelists, if you were entering, this career today, Les probably hope because she's closer to coming out of school and into the workforce. How would you change your preparation in any way to facilitate entry?
I can start. I would hope kind of echo this a little bit. I do think getting exposure to sort of some of the tools needed for data analysis and so forth are critical. Would I change my preparation? I think I would have listened, and this maybe isn't that relevant to this group, but I'll share it because it's sort of an interesting pathway in. In medical school, they had us all take sort of an aptitude test for which specialty you matched. And my number 1, 2, and 4 were all in preventive medicine. So it was aerospace medicine, OC medicine, preventive medicine. And at the time, I'm like, I don't know what that is. I'm going into ER because I like to do procedures and I like the shift work. And I changed partway through, went and did a preventive medicine residency, did an addiction medicine residency after that. So would I have changed that? Maybe, maybe not. All of your past experience is sort of useful in getting you where you are. But I do think getting broad exposure to what public health is, the practice of public health in the public sector, public health in the private sector, seek out opportunities to talk to people that are in the different areas, because public health is such a diverse field that you don't really know everything that's out there. And I'd say that is probably the advice I would give. And just, even if you think something might not be the most interesting to you, if you have the opportunity to explore it, it's probably worthwhile, because you never know where you're going to find yourself presented with an opportunity where that skill set might be useful.
Really excellent advice, Dr. Quick, and thank you for sharing your story with us here today. Well, we're just coming up on a minute, and we seem to get moved to that main room so quickly. I just want to say thank you to all of the panelists. I think there's a question here. Do either of you want to try to tackle this? You can also answer it in the chat if we get bumped to the main room. But I want to make sure that I thank all of our panelists for today, for joining us. Thank you for your expertise. Thank you for your advice to our students. We're sure that this group is going to do great things, and we appreciate you investing in the next generation.
Okay, welcome back. Right now, I will introduce Dr. Phil McCallion, who will introduce Kimberly Ali, our keynote speaker, and we'll get started momentarily. So
Yes,
welcome,
it's still
Bill.
morning. So good morning, everyone. This has been a really great event so far, but I think only gets better. I am very pleased to welcome and to introduce Kimberly Ali, who is the Commissioner for the Department of Human Services in the city of Philadelphia. In her role as Commissioner, she oversees both child welfare and the juvenile justice operations. And that includes things like the Child Abuse Hotline, child abuse prevention, juvenile justice diversion efforts, as well as the city's juvenile justice detention center. She leads a department of 1,500 employees. She oversees a budget of $770 million. And while she is with a public agency, she also supports the vitality and the quality of many not-for-profit agencies in the city as well through the funds that she manages. Ms. Ali began her tenure with the city in 2000 as a DHS social worker. And that feels like a moment for me to pause and to say to students and alumni that often we think that our first job will define our career. And I think in Commissioner Ali's case, that is true. She's never forgotten that connection with individual families and with children. As she rose through the ranks of DHS, she also exemplifies what I often speak of in the careers of social workers. Within a short time, you may be called upon to assume leadership positions. In Commissioner Ali's case, these have included Director of Provider Relations and Evaluation, Director of Provider Relations and Evaluation of Programs and Operations, Director for Ongoing Services in the Children and Youth Division. More recently, she was Deputy Commissioner for Child Welfare Operations. I also think too that as students think about the courses they're taking, sometimes they may wonder, will I ever use that particular course and the content that was presented there? And in a career such as Commissioner Ali's, I suspect that over time, policy, macro practice, and research courses were the ones that she came to reflect on the most. Commissioner Ali's career has been one of considerable and important achievement. Among her most notable achievements have been her work to reduce the number of children in placement by 1,400, and ensuring that more children are placed with their families, that we're connecting families to prevention services to safely divert them from the Department of Human Services, and increasing community-based alternatives to detention. Commissioner Ali holds a BA in criminal justice and a master's in social work from Temple University. We've talked many times. She is a proud graduate, and we are proud of her. Commissioner Ali.
Good morning. Thank you for that introduction. Sometimes when I hear my bio, I look around to say, who are they talking about? Because I am just a young lady born and raised in Philadelphia, in South Philadelphia, and I love the city of Philadelphia. So again, I thank you for that introduction. So while my position is Commissioner of the Philadelphia Department of Human Services, my profession is a social worker. I am a social worker. I am a public servant. And as a public servant, I am honored and extremely humbled to be speaking to you today about building a career in public service. However, before I go any further, let me extend some acknowledgements. I want to thank the Temple College of Public Health Professional Development Committee, the members of the Board of Visitors, the Alumni Association Board, and finally, special thanks to Brian Lindbergh, Marvin Nichols, and Jasmine Edwards for all of the work that you put into making this day happen. Again, I thank you for extending an invitation to me. Much like some of you, my career path was not crystal clear when I graduated from Temple with my undergrad degree in criminal justice. To be honest, I would describe my career path as a bit murky. In May of 1996, I found myself a graduate without a job. I thought that I was going to go into law enforcement, hence my undergrad degree in criminal justice. But I soon realized that this young lady from South Philadelphia was afraid of guns. So instead of going into law enforcement, I discovered social work, or should I say social work discovered me. My first job was as a residential counselor in a placement facility. Hats off to people who can serve in congregate care facilities, because I quickly learned that serving in a residential placement was not a good fit for me. To be honest, I lasted only 30 days in that job. This leads me to my first point in terms of my journey to public service. You must know when a job is not the right fit, or when it is no longer a good fit, so that you do not do a disservice to people, families, or communities. As I continue my journey to public service, I found myself unemployed yet again. So I started my job hunt a second time. This time I was able to get hired as a social worker, working with families who had a report of child abuse or neglect. These families needed services to help their children in their homes and communities. I must admit that I absolutely loved that job. I was working in the community, helping families. How empowering. The job was extremely rewarding, and it gave me a sense of purpose. Although I loved that job as a social worker, I decided to leave that job to work for another provider. I was doing the same work, but left for what I thought was a greater reward: more money. This leads me to my second point on my journey to public service. Let me forewarn you that it is a cliche. The grass isn't always greener on the other side. I left one agency to work for another agency simply for more money. But I soon found out why I got a higher salary at the second job. The first job had the administrative infrastructure to support me as a social worker versus the second job. Much like our families that we serve at DHS need a supportive network of family members and friends, so do social workers. I was making more money at the second provider, but I didn't have the necessary supports to make me as successful of a social worker. However, I learned a lot from the second job. It taught me work-life balance because I was working non-stop. I had to learn to create boundaries between my professional self and my personal self in order to avoid burnout. The need was so great in the communities. Although I loved being a social worker, I eventually left that job too. Y'all get this pattern, right? However, this time was different. As opposed to searching for another job, I decided to go back to school for my master's degree in social work. Going back to school was certainly a significant stop on my path to public service. Shortly after graduating with my master's degree in social work, I began working at the Philadelphia Department of Human Services as a social worker in a family service region. This was in 2000. This position gave me an opportunity to work with children and families to either prevent them from being removed from their homes or to reunite them with their families or with another forever family. Although there is a tremendous amount of stigma attached to DHS, given our mandates around the safety of children, from my first day of employment, I embraced my role as a DHS social worker. I was determined, even as a social worker on the front lines, to make a difference in the lives of families. I would do this family by family, advocating and supporting them, showing them the respect and dignity that they rightfully deserved, listening to youth and parents and allowing them to develop their own paths out of the child welfare system, and serving them. Yes, I was there to be of service to them. What I learned at DHS was that I am a true public servant. No matter what position I held, I was there to be of service. So whether it was on an individual level, while I was a social worker serving families in their homes and communities, or on the macro level, Phil, as commissioner, I am at DHS to be of service. My desire to serve is grounded in social justice to ensure that people who are marginalized, discriminated against, and overlooked have equal access. In addition to being grounded in social justice,
My desire to serve is also grounded in my spirituality. I often reflect on this verse in the Bible that says, "The harvest is plentiful, but the laborers are few." Yes, the laborers or public servants are few, but the harvest is indeed plentiful. The harvest is plentiful in the streets of Philadelphia, in North Philadelphia, where Temple University is. The harvest is plentiful in city government and at the state legislators. The harvest is plentiful in the physical and behavioral health fields. The harvest is plentiful in Congress and even at the White House. So there is enough work for all of us to do. Please know that under no circumstance am I saying that the journey as a public servant is easy. There are certainly days that I feel like I can't do another thing. I can't respond to another email or attend another Zoom meeting, of course not this one, or even answer another telephone call. And you too may feel like that. But when I am feeling that way, that leads me to my third and final point on my journey as a public servant, remembering the why. So I disconnect and I reflect on the why. Why am I working at DHS? Reflecting on the why is important because you are reminded that you are in your role to serve, to help, to make a difference in the lives of people who are often overlooked, voiceless, disempowered, and traumatized. Remembering the why provides me with renewed energy to keep serving. In closing, I would be remiss if I didn't do a shameless plug because DHS is always in need of public servants. So if you are interested on embarking on a journey as a public servant, you can go on the City of Philadelphia's website and click on the tab that says Jobs. Again, I want to thank you for allowing me to speak to you today. I am happy to answer questions. However, let me start with the first question for all of you. Are you ready to serve? Thank you.
Thank you, Kimberly. We are so grateful for your time today and for this outstanding presentation. We did have some questions pop up, and I will pull them up shortly. So as you navigated your first few years out of college and really determined which professional direction that you wanted to move into, many of our attendees are seniors or recent alumni who are in that same process right now. What advice do you have for graduates who are navigating the job search and are feeling uncertain about their next steps?
Yeah, and I would say certainly in my experience, for some reason, I think I thought that a job was going to come knocking on my door. I mean, I was a graduate. It was May of 1996. I really didn't land my first job until around August. So I had 3 months of being unemployed. And then I was like, wow, like I need to get a job, right? So I actually applied for the first job that hired me, right? So I would say there is nothing wrong with exploring because sometimes you're not sure. I thought for sure if I go back to my 8th grade graduation book, I thought for sure that I was going into law enforcement. You couldn't tell me anything different, that I was going into law enforcement. I was fortunate enough in my undergrad career at Temple to land an internship at the Drug Enforcement Administration. Again, thought I was going to go into the Drug Enforcement Administration or FBI. And I started asking questions around guns and shooting individuals and couldn't understand why you didn't shoot to just hurt the person and not necessarily kill the person. So I struggled with that and grappled with that for some time. So then when I realized that that certainly wasn't me, you know, in terms of law enforcement, that's when I ventured out to try to find something. But as I indicated when I first started talking, when I landed a job in residential services, it wasn't a good fit at all. The training was phenomenal. I loved the young ladies that I was working with, but it takes a special person to work in residential. That's why I give them all of, you know, the kudos, all of the respect to care for someone
8 to 12, sometimes even 16 hours a day is a lot. So I would say that exploring, is nothing wrong with exploring. I would recommend that if in fact almost immediately, or when you realize that it's not a good fit, then you should leave that particular job and look for something else, because you will begin to do a disservice. If I was to be completely transparent, I do on occasions talk to social workers here who's been here for a long time. They've been here for a long time, some of which are burnt out, and they stay because they feel like now they're locked in. The money is good, you got the security of a city job, but again, it leads to doing a disservice. So I wouldn't be discouraged. I certainly wasn't discouraged, leaving jobs, finding myself unemployed. Just be persistent and continue to press forward.
Thank you. And that really embodies Tempo's model of perseverance conquers. And that's exactly what you're talking about right now. Wonderful. We had one more question that came through. And as you navigated your different interests, as well as these first few jobs, we've talked a lot about mentoring today. Did you have a mentor or some people who you could call on for advice as you navigated this process? And what sort of things did you ask them?
Yep. So I was fortunate enough. I won't say that I had a mentor once I graduated from Temple. I didn't have a mentor. I should say I didn't have a mentor in social service. Certainly had, mentors in my life, but not in social services. But almost immediately when I came to DHS and was assigned to a unit, there were social workers in that unit. There were social workers that were on the floor that were what we call seasoned social workers, who took me under their wing. So we didn't have a formal mentorship relationship, but when I reflect back, they are the individuals who poured into me. So I would certainly say that they were mentors to me when you were, afraid to necessarily, how we say no question is a dumb question, but you young, you're a social worker, you new to the job, you like, should I ask my supervisor this or should I not? Because you have this, mask or this image that you want to at least appear that you know what you're doing. I utilized them. I would go with them in the field. They, again, took me under their wings and they showed me the way. So what we also do, and what I continue to do, even as a commissioner, I mentor. So I mentor other social workers. I mentor other social workers, not only internally at DHS, but also at our provider agencies. We have a close partnership with community umbrella agencies. Y'all probably heard that terminology called CUAs, in which I mentor someone because I believe in giving back. And I also know that it helps people professionally as well as personally.
Thank you. That's really, really helpful. And we're so grateful that you continue to mentor, because it's so important as we, so many people are navigating similar situations, and the fact that you provide that to so many in our community is such a service. We thank you for that. We have one more question for you. If you don't mind, we had a lot come through. Next question for Kimberly. How did you know that working for DHS was the right fit for you?
I knew that because I absolutely loved it. I absolutely loved it. Was scared sometimes because, it's certainly the unknown when you get a report and you have to knock on, an individual's door and discuss with them, the allegations that was made against them. So sometimes definitely had like a little fear, a little pit in my stomach. But again, I had those strong mentors who told me, don't act like you're afraid now, right? So try not to act like I was afraid. But from the beginning, I absolutely loved it. It was definitely hard work, but it was so rewarding to me. And then I always had in my head, because I was familiar with the stigma attached with DHS, I always had in my head to be respectful. Even when parents are upset, because when I think about it, I have a daughter. And if I thought about a DHS social worker knocking on my door, y'all will call me resistant too. Y'all will call me resistant. Y'all probably will give me some mental health diagnoses. So I also realized that if I put myself in their shoes, I will feel the same way. Particularly if you feel like you're a good parent, right? If you feel like you're a good parent, And then, there's a report called against you. So I knew almost immediately that I loved being a social worker. So funny, because after 2 years, so I became a social worker in 2000, so January of 2000. And then maybe about a year and a half of me being a social worker, the city offered the test for supervisor. And I remember one of my mentors coming to me to tell me that, the test was being offered as the supervisor. And I said to him, I said, I don't want to be a supervisor. I love working in the field. I don't want to be a supervisor at all. I still want to be a social worker. I felt like after a year and a half wasn't sufficient. And he reminded me, okay, you went to school and got your master's. So instead of you impacting your small caseload, you'll have 5 social workers, and then you can impact, some other families as opposed to your little small caseload. So I knew almost immediately. I think what helped me stay at DHS, so again, started in 2000, was the fact that I served in different positions. So it always kept me fresh and renewed, because I was always learning something different. I will definitely be completely honest with all of you, in that when I think about coming in at 2000, I had no idea that I would be a commissioner. So became commissioner in January of 2020. So 2 months, less than 2 months before the pandemic hit. So I will also be honest in that my role for like the first 6 months was definitely reactionary, because I had to move this huge organization virtual. Despite the fact that DHS social workers go in the field most of the time, they come into the office pretty much almost every day. So imagine just moving them to a virtual platform. And then also our other staff was a huge feat, and certainly credit to all of my staff that certainly helped. But I knew almost immediately that social work was the right job for me. And even when I was in the the private sector, as a social worker going to families' homes, I knew, almost immediately then too, and the families educated me. My staff laugh at me because I have so many funny stories, me trying to navigate, me developing as a social worker. The family certainly gave me a run for my money, and I loved every bit of it.
Outstanding. Well, Kimberly, thank you for sharing how you've navigated your career path, and for all of the important equity and social work that you do for families and youth in Philadelphia. We would also like to congratulate you on being named the Gallery of Success awardee for the Temple School of Social Work. We're so grateful you could be with us today.
Thank you. Thank you. So honored, y'all. Thank y'all for inviting me. I love Temple University, TU.
Absolutely. Wonderful. Well, what a morning it has been. As you reflect on the sessions you attended today, we invite you to consider how you will implement some of this guidance and some of these practical tips as you navigate your next steps after graduation, or as you continue in your professional career. For a chance to win some branded gear, please send us your biggest takeaway from the Professional Development Symposium through the chat, or you can also tweet us at #TemplePDS. We'll be monitoring that all day today. If you missed any of the sessions, or if you had a hard time choosing between the breakouts, please look out for our follow-up email, which will include a link to the YouTube playlist, which will contain all of the sessions. Additionally, we will circulate specific instructions on how to sign up for Owl Network, Temple's professional network, where you can find resources from the Career Development Office, connect with Temple alumni, and also access the college's mentoring program, which you may have heard about today, that we are planning to launch later this year. I would like to thank you for attending the first Temple College of Public Health Professional Development Symposium. Between class internships, personal responsibilities, or if you are working full-time, we know it can be hard to carve out time for your professional development. Your professional development begins when you first start as a student at Temple, and it continues throughout your career. We're thrilled you could join us today, and I'd like to extend one final thank you to our industry expert speakers and panelists, many of whom are alumni from Temple University. We're grateful for you for sharing your professional journeys, tips, and wisdom with the entire Temple community. Thank you, and we hope you enjoy your weekend.